excellent speaker, and he's in the FICCI Medical Tourism Committee, and he speaks, in quality and brand management, and so we have heard him in many forums. So that is Harish Pillai can start, and then Dr. Alexander. Alexander is here.
Yeah, I'm there.
Yeah, Alexander, sorry. Dr. Alexander is the managing director of, of the Baby Memorial Hospital, and well known in FICCI, HPI, and all the associations. And we work together in most of the areas. And we are very happy to welcome you, Alexander, for this session.
Thank you.
And Dr. Jayakrishnan is, previous as a neurosurgeon. Is working in EMS Memorial Hospital in Perithalmanna, and he is previous president of IMA, and very actively involved in the recent, debate with the government about our price restrictions, and as well as the cost to discussions. And so we discussed about going to the court and all that, most of you know. So Dr. Jayakrishnan, we are very happy to invite you on behalf of FICCI to this session. Dr. Harish Pillai, would you like to start, please?
Sure, Dr. Sadullah, thank you. Savio, can you put up my slides, please?
Yes, sir. Yes, sir. Yes.
If you can put it on the full screen. So with your permission, Dr. Sadullah, I'll just start up. I just have 2 slides for all of you. Next slide, please. So I just want to talk about short-term and long-term. When I talked about short-term, it's something to look at for the state of Kerala from 12 to 24 months, and long-term is beyond 24 months. Next one. Next slide.
Yeah.
So clearly what we just discussed broadly, the quantum of vaccination. So I think I was really happy to hear the meeting between the Chief Minister, Sri Pinarayi Vijayan, and Prime Minister Modi asking for more vaccine stock for the state of Kerala, which is very important that we need to, this is the only way for us to have some degree of herd immunity. So vaccinate every resident of Kerala, which includes guest workers, by December, and that has to be done on a war footing. And this is the only way for us to mitigate the challenges which will emerge from the third wave too. And of course, frontline workers. We are also looking at comprehensive life insurance and health insurance package from the government of Kerala for all healthcare workers in the public and private sector. So this is something for the minister to consider. Augment preparations, like we should not be again looking at replicating the war room and other aspects, is mainly for oxygen requirements. We do not really understand till now, like what Dr. Sadullah rightly mentioned about the mutant variety in the next 2 to 3 months. We just do not know. But clearly, if you assume that it's the respiratory system again in focus, Kerala needs to look at possibility of challenges between interstate borders, whether it's Tamil Nadu or Karnataka, in which case we have to depend on our own oxygen production. And this is something which I hope the government of Kerala can act upon. There is already a directive from the government of India asking all public and private hospitals to set up their own oxygen generators. So I think on a collective PPP mode, with the help of government of Kerala, I think that will give it a big catalyst. I also want to bring to the attention of this forums that various state governments, specifically the state of Maharashtra, state of Andhra Pradesh, state of Telangana, they have also given subsidies in terms of CAPEX subsidies, OPEX subsidies to help private hospitals set up these oxygen generators. Because if you fulfill the national requirement, the specification of oxygen generators, they will be sort of unaffordable, prohibitively expensive for small or medium type of hospitals. So this is the third point which I would like to request the government of Kerala to consider. Of course, this current strategy of modulating public behavior or behavior of the common man, we need to also have some sort of carrot and stick policy. In terms of carrot, I suppose, is just what we're anyway doing in terms of easing of the restrictions. But there has to be also some sort of deterrence of law, because still, in spite of us being a 100% literate state and educated state, we are unable to maintain social distancing in many of day-to-day activities. So I think there has to be some teeth also in terms of legislative or punitive actions to modulate behavior of the community. Next slide. Savio will go to the next slide. Yeah. We talked about genome sequencing earlier, and which is very important because our TPR ratios in several of our districts continue to be high, predominantly in the northern districts, whether it's Malappuram, Kozhikode, Kasaragod, Kannur. I think it's very important now with the arrival of Zika in Trivandrum district, and earlier we had the Nipah outbreak a couple of years back in Kozhikode. So one needs to wonder that, I suppose it's also to do with the constant inbound travel. Most Malayalis are global citizens, and also a lot of Keralites are in other states of India. So there is bound to be both rail travel, road travel, and air travel into the state of Kerala. We are the only state with 4 international airports right now, and that is a reality which we have to factor in. And of course, in today's modern world, pandemics are accelerated through modes of transportation. So it's very important for us to have the best possible infrastructure and sufficient budget support, and push has to be given by the state government. The second point in terms of long-term strategy is that we need to create and strengthen a cadre of healthcare professionals. Like we have seen the scenario in most of the TV channels around the country, that you have basic core clinicians, whether it is from cardiothoracic surgery, cardiology, and others, who have become spokesperson for a public pandemic or a let's say an infectious disease. Usually you find experts, domain experts such as infectious diseases personnel, or an epidemiologist or public health professionals being the spokesperson for the larger community. And the reality is that both at the national level and the state level, we are having a short supply of qualified and trained manpower. So one request to the state government is, with the help of KUHAS, if we can create and push ahead with a cadre of epidemiologists, public health professionals, community health experts, and healthcare economists. Many of us in the private sector, sometimes we struggle in our debates with representatives of the state government, whether it's the administrative services or even with ministers, because clearly there is a certain lens in which members of public administration look at the private sector. But the fact remains that whether you are in public health or in private health, there is no free lunches, in the sense that there is an amount of investment required. In the case of public health, of course, it comes from the Consolidated Fund of India or from the state government budgets, which is again funded by the taxpayer. In the case of private health, it's out of pocket, or some insurance agency, whether it's a public insurance or private insurance, funding the care in private hospitals. Therefore, it's also essential to have healthcare economists joining debates, which I think is essential for us to prepare for the future. Another point which I've been talking out for the past many years is that while our infrastructure and quality of healthcare in the public space is highly commendable from a pan-India point of view, I think we can go a step further in ensuring quality accreditation programs for all public hospitals, coming down to the district level. So, for example, if you look at Trivandrum, there are many eminent public hospitals in addition to the Trivandrum Medical College out there. Of course, Chitra is a National Institute of Eminence. If all these institutions can have the NABH accreditation, I think that will be one huge feather for the state of Kerala. My last point is that in terms of data collection and data interpretation, the disease pattern in Kerala as a population is quite fascinating. One is we have dubious distinctions in terms of morbidities. We are perceived to be the #1 state for type 2 diabetes in the country. We have the longest longevity and life expectancy in the country. We are #2 for obesity. We are #1 for pancreatitis. We are, I suppose, if you look at the national crime records, we also have the dubious distinction of highest per capita incidence of suicides in the country. So it's a mental health issue also to be. So what I'm trying to say is that if we can have an automated, intelligent medical records which links the primary healthcare centers, the taluk headquarters, the district headquarters to all the public hospitals, and I suppose some kind of bridge also to link up private hospitals. And the National Digital Health Mission, which was announced by the Prime Minister on Independence Day last year, sets the legal and the regulatory infrastructure to push ahead for an electronic medical record systems. And this will help, especially in a state which has got fiscal challenges, where we need to extend maximum bang for the buck when our healthcare budget is also limited in spite of greater allocation as a percentage to GDP for healthcare, specifically for Kerala. I think it's important that we now start looking at data mining, first capturing the right capturing of data and analysis so that we can understand the pockets of differentiation and not have a one-size-fits-all strategy for the 14 districts in Kerala. This is one important point for the state government. Kerala is also already a pioneering state in terms of antibiotic surveillance, and also to look at the big challenge of antibiotic resistance across the state. And in that way, it's already commendable for the rest of the country. But I suppose if we also look at extension of technology, especially artificial intelligence in early monitoring of emerging epidemics and pandemics, I think then we can be at least proactive rather than be reactive. So these are overall my points. Thank you for your time, Dr. Sadullah.
Hi, thank you, Harish. I think you touched upon very important points of our survival strategies and oxygen generation and if government subsidies. Some of the other state governments have already declared a government subsidy. So I think it's a great point. We will repeat to the minister and see. And then, of course, genome sequencing and collaboration with the government and the private sector is needed. I think pandemic, if we can bring one thing in Kerala is that we should government, private sector, public sector, government should recognize the private sector and try to collaborate. And of course, data collection all over the country is a big question. And I think we should have a good system in spite of all digitalization we are talking about. And in fact, I was talking to Jaykrishnan, the data collection, it still remains one of the weakest link in our medical, public health, implementation. Anyway, let us go, and it is my honor to invite Dr. Alexander, Managing Director, Baby Memorial Hospital. Dr. Alexander, please.
In fact, now, good evening, everybody. I just only 5 minutes back only I got my link also. I didn't know what exactly is happening here. There's a FICCI meeting. I was called 2-3 times. I didn't get any link. I don't know.
No problem. No problem at all. Only thing is we are discussing if you have a point on sustainable strategies in the post-COVID atmosphere in Kerala. And that's where some of the points Harish Pillai brought out. Would you like to elaborate, or would you like to say any point in addition to that? You are welcome. Or you want, I can invite Jaykrishnan, and then you can come in later on. And it doesn't matter at all.
Yeah, Dr. Harish has very well explained all the details. Unfortunately, our minister could not hear it. I think you should take the points and bring it to our notice, to the government's notice. That is one.
And, some of the points I will repeat it.
No, regarding the vaccination, that's the most worrying now. And last 3-4 weeks now, we have been, we don't have the vaccines available with most of the hospitals, except a very few who had already got it before the restrictions and other things. So that's the main thing which we'll have to somehow by July, August, September, we should completely vaccinate the entire population in Kerala. That's what I feel. We can do it without any difficulty if the private sector is taken into consideration and given them adequate doses. And fortunately, I am told that they are shipping tomorrow from the Serum Institute. So that should take place immediately. That's what. And regarding the oxygen manufacturing and other things, it is not practical in most of the hospitals, including mine, I can say, because I don't have space there. So that's a major challenge. The government should not put any sort of compulsion on that, but the pooling can be done in some points, not depending only on 1 or 2 units in Kerala. The government should definitely support it. And I don't expect any subsidy from any of our government side, though we can demand for it, because we are deprived of all the privileges, though 60 or 70% of the healthcare is being, provided by private sector. The private sector is not taken into consideration. All are branded as, unfortunately, as dacoits or some sort of, I don't know how to name it. So that is very unfortunate in our setup. Neither the government nor the public or the court or even the media, none of them are giving importance to the private sector, the sufferings what we are having. And Kerala being the largest, the highest salary paid for the minimum wages considered. Now, none of the states have got this much of minimum wages. And expenditure is the same in Mumbai or in Kerala, in any place in Kerala. It's all the same. So that is not taken into consideration. The price ceiling has to be taken out. Price ceiling in an ICU cannot be compared with the ICU of one major hospital and ICU in a medical college or in a smaller setup. So these are the things which the government should look into. The ceiling has to be taken out. And of course, this lockdown also to be relaxed now. This 1 day, 2 day opening of the shops, it's already creating havoc. People are crazy when it is open. Now they're crowding in the shops. So that has to be taken out. Is my suggestion.
Thank you. Thank you, Alexander. I think even though you were not prepared, you brought out good points. The price limit should be taken out. We all support that. And lockdown, of course, IMA is a big, making good arguments on taking out the lockdown or modifying it. Anyway, I'm very happy to invite Dr. Jayakrishnan, who is very well-known neurosurgeon, previous president of IMA, and very happy to invite you, Dr. Jayakrishnan, to this forum. Please go ahead.
Thank you. Thank you, Dr. Sadullah, Co-Chair Fiki, and all the co-speakers and friends. It's very important that we have to plan the post-COVID healthcare scenario. Already, Dr. Harish and Alexander have put forward a lot of points regarding that. First of all, my suggestion is that regarding the COVID treatment, this exclusive COVID hospital concept should be taken away and all hospitals should start treating COVID. And as Dr. Alexander told, there should not be any restrictions for treating it. Even the financial restrictions may bring in catastrophe. And another important area is regarding the non-COVID illness, which has been almost neglected for the past 2 years, both for the poor and rich. The poor due to non-availability of treatment centers, and the rich also due to the more focus on COVID. Especially now people are walking who require THR, TKR. Everybody is walking with pain and all because such purely elective non-COVID illness treatment is not happening. And as such, we have forgot the general principle of managing any epidemic illness is that the mortality or morbidity due to the non-COVID epidemic should not surpass that of the epidemic. So we have to study and find out data on what has actually happened in our state and country. And another important area is which has affected is medical tourism. As such, both our country and Kerala was expanding rapidly in the medical tourism sector, but now it is severely affected. And we have to see how fast we can bring in proper facilities for bringing back the amenities for the medical tourism sector. And the post-COVID healthcare scenario may see rapid strides in telemedicine. So almost all the hospitals will have to start telemedicine. There should be telemedicine hubs. All the facilities should come. And another area is out-of-pocket expenditure in healthcare. We know that the out-of-pocket expenditure in healthcare is around 80% in our country and in our state. And government's effort to decrease this out-of-pocket expenditure are haphazard, are not focused. The health insurance penetration is low. We have to improve the health insurance penetration. And the strategic purchasing by the government for tertiary and quaternary healthcare is also largely affected due to poor package rates, and that has to be improved. The government should be committed to purchase better healthcare for the poor people, but that should be by offering appropriate package rates, etc. And we will see a lot of changes in the diagnostics. There may be more home-based care. So we have to be prepared for more home-based care. Especially the treatment areas may change in near future by the next 15 or 20 years from hospitals to home. And the elderly care also is important because Kerala has got an aging population now. And if you consider the future scenario, long-term future scenario, there may be a lot of technological breakthroughs. We may be going for artificial intelligence. The diagnostic centers may wane up. There may be wearable diagnostics. And as the scan centers, everything may not be there. And even the health, the larger hospitals may turn into health campuses. Like what the shops turn into malls, the larger hospitals may turn into health campuses. And those who don't turn into health campuses may be focusing on specialty care only. And the home may be the ideal center for both treatment and for research. That may be the future. And another important area which Mr. Harish will also touch is regarding the data collection and record keeping. So there is a national digital health mission which has been launched. But we have to focus on these personalized health records, electronic health records, data exchange for the health records, and the consent managers. Everything should be appropriate because a portion of our population is illiterate, especially regarding the digital areas. These consent managing systems should also be appropriate. So we will see more focus on healthcare, more on research, and more investment will come to healthcare, especially regarding treatment of pandemics and other diseases. And more public funding we will require, then tech-based solutions, and there should be more focus on primary care. That's what I have to say. Thank you.
Thank you, Dr. Jason. I think you touched upon many points there, and I think some of them might have been mentioned by Harish Pillai, but everyone agrees on removing the reservations of the beds and price limits. You brought digitalization and data collection. It has to improve. The penetration of health insurance is a major factor we can mention to the minister. And home-based care and insurance coverage for and the reimbursement for the home-based care are very important, points. And we will try to repeat it, to the minister. So we will go ahead with the next session also. I think so that we can cover up with the time. And the second session is medical devices and equipment manufacturing and services under our Atmanirbhar scheme. And Atmanirbhar, I think has come in a great way now, and people are interested to work on this. There is a life science park coming into Ventram, and they are also trying to accommodate many of these, new ventures. And it's a pleasure to invite, Mr. Thomas John, Managing Director of Agape Diagnostics, which is very famous by this time. And they have established an excellent diagnostic, manufacturing since 1994, and they have come one of the very prominent companies in India now. And Dr. Thomas John is here. Thomas John, yeah.
Yeah,
I didn't see. Yeah. Hello. So I didn't see you. And then Dr. John Kuriakos, Managing Director at Dent Care and Dental Labs Private Limited. And I'm very, he's very well versed with the dental clinic technology, experimental on quality of the dental processes, and it traveled across the globe and trying to improve and bring innovation into the dental care. And I'm very happy to invite John Kuriakos also to this session. Dr. John Kuriakos, yeah. And then Ravindran is a good friend, Managing Director of Palkad Surgical Industries, and with whom my institution has got a long-term relationship for the last 20 years. A very reliable product. They started with patient beds, and now they got a very much automated operation theater. No, they started with operation theater, but tables, and so they have branched out. And so I'm also happy very much to invite you, Mr. Ravindran, to this session. And Bibu, you don't need any introduction. He's the chairman of the healthcare panel of FICCI, and is also the director of the Medivision Scan and Diagnostic Research Private Limited. So Bibu, you can also you're also joining, and so over to see Thomas John, medical device, about medical devices and what we can do at this point of time. In a briefly for 4 or 5 minutes, we would appreciate. Thank you.
Yeah, good evening to all. And first of all, my thanks to Dr. Saudullah sir and the FICCI team and for arranging this program. So I am representing a small subdivision of medical device. Medical device as a whole, India, it's something around 75,000 crore business per year, where I am representing a division called in vitro diagnostics or lab diagnostics, which is very small, 15,000 crores. But today, last 1 year, because of COVID-19, signified the importance of lab testing for COVID. Maximum public testing and isolation strategy is the only remedy for the prevention. So naturally, the importance of the laboratory diagnostics have increased last 1.5 years. Even all the COVID testing or COVID prognosis testing also, all the complications, the laboratory testings are very, very important, that everybody is aware about that. Today, I just wanted to mention about 4 or 5 key issues. As a manufacturer, one of the biggest manufacturer in India for the laboratory diagnostics. Always the laboratory diagnostics, when we talk, it comes under the medical device. Even 4-5 states, including Kerala, is having a separate medical device park. But one of the submission is that, is there any possibility that whether we can have a separate laboratory diagnostics manufacturing park, that means in vitro diagnostics park, so that there can be a focused approach is possible. Today, as a company, we have about 800 people, and we are very happy to say that about 5 to 5.5% of our revenue we invest on R&D. So that sort of R&D we are doing last 10 years. We are doing as part of the Atmanirbhar program, because that came popularized last couple of years. But even from 2011 onwards, we started, bringing a lot of localized products in India. And what I understood that today, even the laboratory diagnostics, if you see that 65% of the products are imported. Of course, people can say that the quality, all these things, but if there is a focused approach, the quality can be improved and the cost of laboratory diagnostics probably can be reduced times. So that is always, it's good to the Indian population. So my focus or my submission is that separate a park. Second is that even we are working with a lot of government and non-government institutions like Sri Chitra, we are working, and a lot of other, even Chennai TB Center, we are working, Tanvas, we are working for the leptospirosis. All these developments are happening. But as a policy in Kerala, at least, is there any possibility that industry, academics, and hospital, there can be a association where basically to focus on the R&D research? So this is something can always improve the technology and we can bring faster turnaround time of bringing a lot of new products. Then when I talk about the third point, today when I'm doing a lot of research, especially we are bringing in the TB diagnostic solutions in the molecular platform, where the TB sample is one of the critical issue. We have approached the Kerala, many government hospitals, but now is there any possibility, at least if we ensure the quality and if you ensure everything, getting access to, the samples, these infected samples, so that we can bring a lot of new technology. Even TB's case itself, now today, it almost 100% we are depending on the imported where the cost is so high. So maybe 1/10 cost, we can bring the local technology where it can equal or better technology where we can give that solution. This is my third point. Then the fourth point is that in laboratories, any laboratories, the quality control material, that is for to check the quality of the results and for calibrate the instrument or calibrate the consumables is very, very important, because according to the NABL guidelines and everything, daily quality run or weekly quality run, or that is very important. The quality control material mainly is coming from the patient samples. So if there is a focus, because today unfortunately 100% quality control materials are coming from outside. So if there is a focused approach, India is a country where even 1.35 billion people are there, and now people are all exposed to the laboratory. If there is a organized way to collect the samples and pool the samples and make the quality control, this can reduce huge our outgoing for the foreign money. So this is my fourth point. Then the fifth is that even entire medical device and in vitro diagnostics, this is reagents or consumables are already covered by the regulatory. Equipments are going to come the licensing very soon. It is good, and always it can bring a lot of quality standards and everything. So my submission is that there should be a localized representation on that. Today, unfortunately, all these things are controlled, or many members are from multinationals. So Indian representations are there, so that when the policy comes in, there can be a focus on the Atmanirbhar, or there can be a focus on the Indian localized manufacturing. These are my 5 points, very simple. IVD separate park. Then second is about joint working with the hospital, industry, and academic. Then third is that about the availability of the samples. Then the fourth is that quality control, material manufacturing and availability. And fifth is that the medical device equipments, there should be a representations from the local companies and local bodies. These are my 5 submissions. Thank you once again, Dr. Saadullah, for giving this opportunity, and Vicky, and thank you once again.
Yeah, Thomas John, thank you very much. I think you're so experienced in this diagnostic area, and you brought up very valid points. And the only point I didn't understand is that the quality control basic studies, you're talking about the quality control, reagents and all, or you're talking about the population-based studies?
No, quality of the reagents and equipment. It's required a QC material. So now the QC material is coming from outside. So it can be manufactured here. provided there should be a government proper approach and sanction for that.
Yeah. Thank you. I think it's all valid points, and we will try to repeat to the minister as much as possible, depending on her time. And so it's a privilege now. I would go ahead and invite, Dr. John Kyriakos. I think he's a doctor, right?
No, I am not a doctor. I am dental technician.
Oh, technician. Okay.
Yeah,
Okay.
technician.
Mr. John Kyriakos, Managing Director, Dent Care Dental Lab Private Limited. Please go ahead.
എല്ലാവർക്കും എൻ്റെ നമസ്കാരം.
നമസ്കാരം.
ഞങ്ങൾ ഈ സ്ഥാപനം തുടങ്ങുന്നത് 31 വർഷം മുമ്പാണ്, 98-ല്. അന്ന് തുടങ്ങുമ്പോൾ വെറും 290 സ്ക്വയർ ഫീറ്റില് 6 ജോലിക്കാരെ വെച്ച് ഞങ്ങൾ 3 ബ്രദേഴ്സ് ഒരുമിച്ചാണ് ഈ സ്ഥാപനം തുടങ്ങിയത്. ആ കാലങ്ങളിൽ പല്ലുണ്ടാക്കുന്ന ഒരു സ്ഥാപനം, ക്രൗൺ ആൻഡ് ബ്രിഡ്ജ് ഉണ്ടാക്കുന്ന ഒരു സ്ഥാപനം സൗത്ത് ഇന്ത്യയിൽ ഉണ്ടായിരുന്നില്ല. അവിടെ ബോംബെയിൽ നിന്നും മറ്റും ചെയ്തുകൊണ്ട് വരുന്ന വർക്കുകൾ പേഷ്യന്റെ മുഖത്തിൽ ഒരു കാരണവശാലും ഫിറ്റ് ചെയ്യാൻ പറ്റിയിരുന്നില്ല. 10-ൽ 2-ഓ 3-ഓ മാത്രമേ ഫിറ്റ് ചെയ്യാൻ കഴിയുമായിരുന്നു. ഞാനൊരു ഡെന്റൽ ക്ലിനിക്കില് അറ്റൻഡർ ആയിട്ട് ആ കാലത്ത് ജോലി ചെയ്യുകയായിരുന്നു. അന്ന് ഈ പേഷ്യന്റെ ബുദ്ധിമുട്ടും അവർ സഹിക്കുന്ന ഈ പ്രയാസം എല്ലാം കണ്ടപ്പോൾ എൻ്റെ മനസ്സിലൊരു ആശയം ഉരുത്തിരിഞ്ഞു വന്നു, എങ്ങനെ ഒരു നല്ല ഡെന്റൽ ലാബ് തുടങ്ങണം. വല്ലപ്പോഴും ഒരു ക്രൗണൊക്കെ കൊണ്ടുവന്നു കഴിഞ്ഞാൽ ഫിറ്റ് ആവും. അങ്ങനെയാണ് ഈ രംഗത്തേക്ക് വരാനിടയായത്. യഥാർത്ഥത്തിൽ ഞാൻ വളരെ ദരിദ്രമായ ഒരു കുടുംബത്തിലാണ് ജനിച്ചത്. എൻ്റെ മാതാപിതാക്കൾ കൂലിപ്പണിക്കാരായിരുന്നു. 14-ാമത്തെ വയസ്സിൽ SLC പാസ്സായിട്ട് തുടർന്ന് പഠിക്കാൻ മാർഗമില്ലാതെ ഞാൻ റബ്ബർ വെട്ടുകാരനായിട്ടാണ് ജീവിതം ആരംഭിച്ചത്. ആ കാലത്താണ് ഈ ഡെന്റൽ ക്ലിനിക്കിൽ വരാനിടയായത്. എന്നാൽ ഏതാനും നാള് 6 വർഷത്തിന് ശേഷം 88-ൽ ഞങ്ങൾ സ്വന്തമായിട്ട് ഈ സ്ഥാപനം തുടങ്ങി. എന്നാൽ അവിടുന്ന് പടിപടിയായിട്ട് ഞങ്ങൾക്ക് വളരാനും ഉയരാനും എല്ലാം ഇടയായി. അനേകം വിദേശ രാജ്യങ്ങളിൽ പോയി ട്രെയിനിങ് എടുക്കാനും ഡെന്റൽ ടെക്നീഷ്യൻ കോഴ്സ് ഏറ്റവും ഉയർന്ന മാർക്കോടെ പാസ്സാവാനും എല്ലാം എനിക്ക് ഇത് തുടങ്ങിയതിന് ശേഷം സാധിച്ചു. ഇപ്പോൾ ചുരുക്കി പറഞ്ഞ 4000-ഓളം ജോലിക്കാരുണ്ട് ഞങ്ങൾക്ക്. എന്നാൽ ഇന്ന് ഇപ്പോൾ 4000-ഓളം ജോലിക്കാരുണ്ട്. അതിനകത്ത് 75% ലേഡീസ് ആണ്. 20-ഓളം ഡെന്റിസ്റ്റ് ഉണ്ട് ക്വാളിറ്റി കൺട്രോൾ ചെയ്യാനായിട്ട്. പ്രോസ്റ്ററോണ്ടിസ്റ്റ് ഉണ്ട്. അതുപോലെ ലേറ്റസ്റ്റ് ടെക്നോളജി, ലോകത്തിൽ എവിടെയെങ്കിലും ഡെന്റിസ്ട്രിയിൽ ഏതെല്ലാം നൂതനമായി എത്ര സങ്കീർണമായ എക്യുപ്മെന്റ്സ് വന്നാലും മിഷനറി വന്നാലും അതെല്ലാം കൊണ്ടുവരാനായിട്ട് ഞങ്ങൾ എന്നും ഉത്സാഹിച്ചിരുന്നു. ഇന്ന് നമ്മൾ വേൾഡിൽ 2-ാം സ്ഥാനത്താണ്. ഇന്ന് ഈ കേരളത്തില് നമ്മള് ഈ മൂവാറ്റുപുഴ പട്ടണത്തില് 4000 പേർക്ക് ജോലി കൊടുത്തുകൊണ്ട് നിൽക്കുന്നു. ഞങ്ങൾക്ക് എല്ലാവിധ സർട്ടിഫിക്കേഷനും ഉണ്ട്. FDA ഉണ്ട്, CE ഉണ്ട്, ISO 5 ടൈപ്പ് ISO ഉണ്ട്. അങ്ങനെ എല്ലാ രീതിയിലും നല്ല രീതിയിൽ നടന്നു വരുമ്പോഴാണല്ലോ കോവിഡ് എല്ലാം വന്ന് ഞങ്ങൾ വെറും വട്ടപൂജ്യമായി പോയി.
ആരും പല്ല് വയ്ക്കുന്നില്ലല്ലേ?
വെറും 74,000 രൂപ ഉണ്ടായിരുന്നുള്ളൂ 2020 മാർച്ചില് ഏപ്രിലിൽ ഞങ്ങളുടെ കളക്ഷൻ. എന്നാൽ അവിടുന്ന് പിന്നീട് ഏതാണ്ട് 14 കോടി ചെയ്തുകൊണ്ടിരുന്ന ഞങ്ങൾക്ക് എല്ലാം താറുമാറായ കണ്ടീഷനിലായിരുന്നു. എന്നാൽ അവിടുന്ന് പതിയെ വളർന്നു വന്ന് വീണ്ടും 11.5 കോടിയിലേക്ക് എത്തുമ്പോഴാണ് അടുത്ത ഘട്ടം വന്നത്. പിന്നീട് അത് ഇത്തവണ വന്നപ്പോൾ 1.25 കോടി ഉണ്ടായിരുന്നുള്ളൂ ആകെ കളക്ഷൻ. എന്നാൽ ഇപ്പോൾ വീണ്ടും പഴയ സ്റ്റേജിലേക്ക് വന്നുകൊണ്ടിരിക്കുകയാണ്. കഴിഞ്ഞ മാസം 5.25 കോടി ചെയ്തു. പിന്നീട് അത് നല്ല നിലയിൽ ഉയർന്നു വന്നുകൊണ്ടിരിക്കുകയാണ്. ഇപ്പോൾ ഏതാണ്ട് 13 കോടിയിലേക്ക് ഈ മാസം തന്നെ എത്തുമെന്നുള്ള പ്രതീക്ഷയിലാണ് ഞങ്ങൾ നിൽക്കുന്നത്. എന്നാൽ ഇന്ന് ഞങ്ങൾക്ക് ഇപ്പോൾ ഇവിടെ മൂവാറ്റുപുഴയാണ് ഞങ്ങളുടെ ഹെഡ് ഓഫീസ് എങ്കിലും ഇന്ത്യയിലെ എല്ലാ സംസ്ഥാനങ്ങളിലും ഞങ്ങളുടെ പ്രസൻസ് ഉണ്ട്. ഡൽഹി, ഗുജറാത്ത്, അതുപോലെ ബാംഗ്ലൂര്, പിന്നെ ഡൽഹിയിൽ ഏതാണ്ട് 100 പേരിൽ താഴെ ജോലി ചെയ്യാൻ പാകത്തിലുള്ള ഒരു മാനുഫാക്ചറിങ് യൂണിറ്റ് ഉണ്ട്. അഹമ്മദാബാദിലും ഹൈദരാബാദിലും ബാംഗ്ലൂരും ഞങ്ങൾക്ക് 10-ൽ താഴെ ചെറിയൊരു സെന്റേഴ്സ് ഉണ്ട്. അതുപോലെ UAE-യിലും UK-യിലും ഓസ്ട്രേലിയയിലും ന്യൂസിലൻഡിലും US-ലും ഞങ്ങൾക്ക് മാനുഫാക്ചറിങ് യൂണിറ്റ്സ് ഉണ്ട്. ഇന്ന് ഞങ്ങൾ നേരിടുന്ന ഏറ്റവും വലിയ പ്രശ്നം, ഞങ്ങൾക്ക് ക്വാളിഫൈഡ് ആയിട്ടുള്ള ടെക്നീഷ്യൻസിനെ, ട്രെയിൻഡ് ആയിട്ടുള്ള ടെക്നീഷ്യനെ കിട്ടാൻ യാതൊരു മാർഗവും ഇല്ല. മെഡിക്കൽ കോളേജ്, ഡെന്റൽ കോളേജുകളിൽ ആകെ 20-ൽ താഴെ സീറ്റേ ഉള്ളൂ. പ്രൈവറ്റ് സെക്ടറിൽ ആകെ ക്വാളിഫൈഡ് ടെക്നീഷ്യൻസിന്, ഡെന്റൽ ടെക്നീഷ്യൻസിനെ പഠിപ്പിക്കാനുള്ള സംവിധാനം ആകെ അമൃതയിൽ മാത്രമേ ഉള്ളൂ. അതുകൊണ്ട് ഞങ്ങൾ തന്നെ അതിന് മുൻകൈ എടുത്ത് 2 വർഷം ഞങ്ങൾ ആളുകളെ എടുത്തിട്ട് അവരെ പഠിപ്പിക്കുന്നു. +2 കഴിഞ്ഞ കുട്ടികളെ എടുക്കുന്നു, അവരെ പഠിപ്പിക്കുന്നു, 2 വർഷത്തെ ട്രെയിനിങ് കൊടുക്കുന്നു. ആദ്യ സമയത്ത് ഞങ്ങൾ സ്റ്റൈഫൻഡ് കൊടുത്തു തുടങ്ങുന്നു. ഇങ്ങനെ വളരെ ബന്ധപ്പെട്ടാണ് ഈ കാര്യങ്ങൾ നടത്തിക്കൊണ്ട് പോകുന്നത്. അതുകൊണ്ട് ടെക്നീഷ്യനെ കിട്ടാൻ ഒട്ടും വളരെ പ്രയാസം നേരിടുകയാണ്. ഗവൺമെന്റിന്റെ ഭാഗത്ത് നിന്ന് ഏതെങ്കിലും ഒരു സഹായം ചെയ്യുകയാണെങ്കിൽ എല്ലാവിധ ഫെസിലിറ്റിയും ഞങ്ങൾ കൊണ്ട് പഠിപ്പിക്കാനുണ്ട്. അതുകൊണ്ട് അങ്ങനെ ഒരു സഹായം കിട്ടിയാൽ ഏറ്റവും നല്ലതായിരിക്കും. എൻ്റെ ഒരു ആഗ്രഹം, ഇപ്പൊ 4000-ഓളം പേരുണ്ട്, 10,000 പേർക്കെങ്കിലും തൊഴിൽ നൽകാൻ സാധിക്കണമെന്നുള്ളതാണ്. തീർച്ചയായിട്ടും അടുത്ത 3 വർഷത്തിനുള്ളിൽ ഗവൺമെന്റ് ഞങ്ങൾക്ക് വേണ്ട രീതിയിലുള്ള സഹായങ്ങൾ ചെയ്താൽ 10,000 പേർക്ക് ജോലി ചെയ്യാൻ കഴിയുമെന്നുള്ളത് ഞാൻ ഉറച്ചു വിശ്വസിക്കുന്നു. ഇവിടെ കഴിഞ്ഞ 33 വർഷമായിട്ട് യാതൊരുവിധ തൊഴിൽ പ്രശ്നവും യാതൊന്നുമില്ല. ഒരു കുടുംബം പോലെയാണ് ഞങ്ങൾ കഴിഞ്ഞുകൂടുന്നത്. ഒറ്റ ഫാമിലി, യാതൊരു പ്രോബ്ലവും ഇതുവരെ ആരും ഉണ്ടാക്കിയിട്ടില്ല. ഇനി ഗവൺമെന്റിന്റെ ഭാഗത്ത് നിന്ന് ഏതെങ്കിലും പ്രയാസം ഇതുവരെ ഞങ്ങൾക്ക് ഉണ്ടായിട്ടില്ല. അല്ലറ ചില്ലറ ചെറിയ ഉദ്യോഗസ്ഥരുടെ ഭാഗത്ത് നിന്ന് ചെറിയ ചെറിയ പ്രശ്നങ്ങളൊന്നും ഉണ്ടായിട്ടില്ല എന്ന് നമുക്ക് പറയാൻ പറ്റില്ല. അത് ഏത് ഇൻഡസ്ട്രിയിലും എവിടെയും ഏത് ലോകത്ത് എവിടെയുള്ള കാര്യമാണല്ലോ. അല്ലാതെ ഞങ്ങൾക്ക് വേറൊരു പ്രശ്നം ഉണ്ടായിട്ടില്ല. ഇപ്പോൾ ഞങ്ങളുടെ എക്സ്പോർട്ട് സ്വീഡനിലും ഫ്രാൻസിലും അതുപോലെ തന്നെ ഇറ്റലി, അതുപോലെ സൗത്ത് ആഫ്രിക്കൻ കൺട്രീസിലെല്ലാം സ്റ്റാർട്ട് ചെയ്യാനായിട്ട് ഞങ്ങൾ വളരെ ബദ്ധപ്പാടോടെ മുമ്പോട്ട് പോവുകയാണ്. ഞങ്ങൾക്ക് വേണ്ട സപ്പോർട്ട്, ഒന്ന് ട്രെയിൻഡ് ടെക്നീഷ്യൻസിന്റെ ഈ അഭാവം, ട്രെയിൻഡ് ടെക്നീഷ്യൻസ് ഇല്ലാത്തത് കൊണ്ട് ടെക്നീഷ്യൻസിന്റെ ഒരു ട്രെയിനിങ് സെന്റർ തുടങ്ങാനായിട്ട് ഞങ്ങൾക്ക് ഒരു അനുമതി കിട്ടിയാൽ വളരെ നല്ലതാണ്. അത് ഗവൺമെന്റിലെ വന്ന് പരിശോധിച്ച് ഞങ്ങൾക്ക് അത് ഉണ്ടെങ്കിൽ മാത്രം തന്നാൽ മതി. 1. 2, ഈ മേഖലയിൽ 137 കോടി ജനങ്ങളുണ്ടല്ലോ നമ്മുടെ നാട്ടില്, നമ്മുടെ ഇന്ത്യയില്. 32 പല്ല് വെച്ച് കൂട്ടിയാൽ ഏതാണ്ട് 4,384 കോടി പല്ലുകൾ ഞങ്ങൾക്ക് ഉണ്ടാക്കാനുള്ള അവസരങ്ങളുണ്ട്. വലിയ അനന്തവിദൂരമായ സാധ്യതകളാണുള്ളത്. ലോകം മുഴുവൻ, ഇത് മാത്രമല്ല, ലോകം മുഴുവൻ നോക്കിയാൽ 768 കോടി ജനങ്ങളുള്ളതില് 24,576 കോടി പല്ലുകൾ ഉണ്ടാക്കാനുള്ള അവസരങ്ങളുണ്ട്. ഞങ്ങൾക്ക് അതിനുള്ള ടെക്നോളജി, എല്ലാ സംവിധാനങ്ങളും ഉണ്ട്. പക്ഷെ ഈ ടെക്നീഷ്യൻസിന്റെ അഭാവം വലിയൊരു കാര്യം തന്നെയാണ്. വേറൊരു കാര്യം, ഞങ്ങള് ഇതിനോടകം കഴിഞ്ഞ 5 വർഷം മുമ്പ് ഞങ്ങളുടെ R&D നല്ല ഭംഗിയായിട്ട് എല്ലാം ഡെവലപ്പ് ചെയ്തു. അതുപോലെ 30ഓളം പ്രോഡക്ട്സ് ഞങ്ങൾ തന്നെ ഇവിടെ ഡെവലപ്പ് ചെയ്തു. വിദേശ രാജ്യങ്ങളിലെല്ലാം വളരെ വിലപിടിപ്പുള്ള ഈ ഡെന്റിസ്റ്റിന് ഉപയോഗിക്കുന്ന RCTക്കും മറ്റും ഉപയോഗിക്കുന്നതായിട്ടുള്ള പല രീതിയിലുള്ള കൺസ്യൂമബിൾസ് ഞങ്ങൾ 30 പ്രോഡക്ട്സ് ഡെവലപ്പ് ചെയ്തിട്ടുണ്ട്. അതുപോലെ തന്നെ മറ്റൊരു കാര്യം, ഞങ്ങള് ഇപ്പൊ ഡിജിറ്റൽ ഡെന്റിസ്ട്രി വളരെയേറെ വളർന്നു പോയിക്കൊണ്ടിരിക്കുകയാണല്ലോ. ഡിജിറ്റൽ ഡെന്റിസ്ട്രി, പണ്ടെല്ലാം ഇംപ്രഷൻ എടുക്കണമെങ്കിൽ ഇങ്ങനെ വെറുതെ ആ കൺവെൻഷണൽ രീതിയിൽ എടുക്കാമായിരുന്നു. ഇപ്പൊ എല്ലാം സ്കാനിങ് അല്ല. അങ്ങനെ വന്നപ്പോൾ ഇതെല്ലാം ഈ സ്കാനർ ഉപയോഗിക്കണമെങ്കിൽ 3D പ്രിന്ററിന്റെ ആവശ്യമുണ്ട്. ഞങ്ങൾ ഇവിടെ തന്നെ ലോകത്തിൽ തന്നെ ഏറ്റവും സ്പീഡ് കൂടിയതും ഏറ്റവും ആക്യുറേറ്റ് ആയതുമായിട്ടുള്ള 3D പ്രിന്റർ ഞങ്ങളുടെ R&Dയിൽ ഡെവലപ്പ് ചെയ്ത് ഞങ്ങൾ പ്രൊഡക്ഷന് വേണ്ടിയിട്ട് കാത്തിരിക്കുകയാണ്. ഏറ്റവും ഫാസ്റ്റസ്റ്റ് ആയിട്ടുള്ള ഒരു 3D പ്രിന്റർ. ശരിക്കും ഞങ്ങൾക്ക് അതെല്ലാം ഇന്ത്യയില്, ഈ കേരളത്തിൽ തന്നെ തുടങ്ങണമെന്നാണ് എൻ്റെ ഏറ്റവും അതിയായ ആഗ്രഹം. ഒരു പക്ഷേ ഞാൻ ആരെയും കുറ്റപ്പെടുത്തി ഒന്നും പറയുന്നില്ല, ആരെയും കുറ്റം പറയാൻ എനിക്ക് അതിനുള്ള പ്രാപ്തിയില്ല. എന്നാൽ ഞാൻ ഒരു കാര്യം പറയാം, എനിക്ക് ഇവിടെ നമ്മുടെ നാട്ടിൽ തന്നെ ഒരു 10,000 പേർക്ക് ജോലി കൊടുക്കാൻ കഴിയണമെന്ന് ഞാൻ അതിയായി ആഗ്രഹിക്കാൻ കാരണം, ഞാനൊരു ജോലിക്ക് വേണ്ടിയിട്ട് റബ്ബർ വെട്ടുകാരനായിട്ട് ജീവിതം തുടങ്ങിയ ആളല്ലേ. അതുകൊണ്ട് ജോലിയുടെ മാഹാത്മ്യം മനസ്സിലാക്കിക്കൊണ്ട് എങ്ങനെയും അനേകർക്ക് ജോലി കൊടുക്കണം എന്നുള്ള അതിയായ ഒരു ആഗ്രഹം. ഏതാണ്ട് 1 ലക്ഷത്തോളം ആപ്ലിക്കേഷനാണ് ഇവിടെ കെട്ടിക്കിടക്കുന്നത്. മറ്റൊരു കാര്യം ഇവിടെ പറഞ്ഞു കൊള്ളട്ടെ, കഴിഞ്ഞ ഈ കോവിഡിന് ശേഷം ഞങ്ങളിപ്പോ ഈ 2ാം തരംഗത്തിന് ശേഷം 200ഓളം പേരെ പുതുതായിട്ട് ഞങ്ങൾ ഇപ്പോഴെടുത്ത് ട്രെയിൻ ചെയ്തുകൊണ്ടിരിക്കുകയാണ്. ഡിമാൻഡ് ഒരു രീതിയിലും ഞങ്ങൾക്ക് തീർക്കാൻ കഴിയുന്നില്ല. 24 hours ഞങ്ങൾ വർക്ക് ചെയ്യുകയാണ്. അതുകൊണ്ട് ദയവായിട്ട് ബഹുമാനപ്പെട്ട മിനിസ്റ്ററുമായിട്ട് പറഞ്ഞ് ഫിക്കി അതിന് വേണ്ട സഹായങ്ങൾ ചെയ്തു തന്നാൽ അത് ഞങ്ങൾക്ക് തീർച്ചയായിട്ടും ഇത്രയും ജോലിക്കാർക്ക് ജോലി കൊടുക്കാൻ, ഇത്രയും ജീവനക്കാർക്ക് എല്ലാ രീതിയിലുള്ള സഹായം ചെയ്യാനുള്ള സംവിധാനം ഞങ്ങൾ ഒരുക്കുന്നതാണെന്ന് പറഞ്ഞുകൊണ്ട് ഞാൻ നിർത്തുന്നു. എനിക്ക് ഇനി അവസരം കിട്ടിയതിൽ എല്ലാവിധ നന്ദിയും പ്രകാശിച്ചുകൊണ്ട് നിർത്തുന്നു.
ജോൺ കുര്യാക്കോസ്, താങ്ക് യു വെരി മച്ച് ഇൻഡീഡ്. കാര്യം വെച്ചാല് ഇത് ഈ ഫിക്കിയിലെ ഇങ്ങനെ ഈ ചില പൊസിഷനിലെല്ലാം വരാൻ പറ്റിയതിൽ ഏറ്റവും എനിക്ക് സന്തോഷമുള്ളത് വെച്ചാൽ ഇങ്ങനത്തെ സക്സസ് സ്റ്റോറി കേൾക്കുന്ന because this is an amazing success story. I have heard of about you. I have never met you. And എനിക്കറിയാം മൂവാറ്റുപുഴയുടെ എവിടെയാണെന്ന് വരെ അറിയാം because I have come there. But only thing is I didn't have an opportunity to meet you. This is a great.
ഒറ്റ കാര്യം സാറേ, ഒരു ദിവസം ഈ ഫിക്കിയുടെ എല്ലാവരും കൂടെ ഞങ്ങളുടെ ഈ സ്ഥാപനം ഒന്ന് വന്ന് കാണണം എന്റെ ഒരു അതിയായ ആഗ്രഹമാണ്. ഒരു ദിവസം
എനിക്കറിയാം, ഒരുപാട് ഞാൻ കേട്ടിട്ടുണ്ട്. And we will definitely come and see that. But it is a real success story, and we will repeat somehow in some, to the government and secretaries and all, definitely for very, very simple, humble needs you have, and you are doing a wonderful job. Thank you. Thank you very much.
Thank you.
Yeah. അതുപോലത്തെ വേറൊരാളാണ് മിസ്റ്റർ PM രവീന്ദ്രൻ. രവീന്ദ്രൻ, ചുരുക്കി ഒന്ന് പറയൂ. What would you like to say?
എല്ലാവർക്കും നമസ്കാരം സാർ. ഇപ്പൊ ഏതായാലും മിസ്റ്റർ ജോൺ കുര്യക്കോസ് തുടങ്ങി വെച്ച സ്ഥിതിക്ക് ഞാനും അത് തുടരുന്നതായിരിക്കും നല്ലത്. നമുക്ക് എല്ലാവർക്കും മലയാളം അറിയാവുന്നതുകൊണ്ട്. ഞാൻ പാലക്കാട് ബേസ്ഡ് ആയിട്ടുള്ള ഒരു മാനുഫാക്ചറിങ് കമ്പനിയുടെ മാനേജിംഗ് ഡയറക്ടറാണ്. കഴിഞ്ഞ 60 വർഷമായിട്ട് പ്രവർത്തിക്കുന്ന ഒരു കമ്പനിയാണ്. ഞാൻ വീണ്ടും ആവർത്തിക്കുന്നു, കഴിഞ്ഞ 60 വർഷമായിട്ട് കേരളത്തിൽ പ്രവർത്തിച്ചുകൊണ്ടിരിക്കുന്ന ഒരു സ്ഥാപനമാണ്. പ്രത്യേകിച്ച് പ്രശ്നങ്ങളൊന്നും ഇല്ലാതെ, പ്രത്യേകിച്ച് ഇന്നത്തെ സാഹചര്യത്തിൽ ഈ വർഷങ്ങളുടെ എണ്ണത്തിന് വലിയ പ്രസക്തി ഉണ്ടെന്ന് ഞാൻ മനസ്സിലാക്കുന്നു. അതുകൊണ്ടാണ് ഞാൻ വീണ്ടും പറയാനില്ലായിരുന്നു. വളരെ ഹംബിളായിട്ട്, വളരെ ചെറിയ തോതിൽ എൻ്റെ അച്ഛൻ തുടങ്ങുകയും പിന്നീട് ഞങ്ങൾ പടിപ്പടിയായിട്ട് പല ശാഖകളിലൂടെ വന്ന് ഇപ്പോൾ ഒരു ഹോൾ മെഡിക്കൽ ഓപ്പറേഷൻ തിയേറ്ററും ഹോസ്പിറ്റലിൽ തന്നെ ഒരു ഡിവൈസസ് സൊല്യൂഷൻ പ്രൊവൈഡർ എന്ന നിലയിലേക്ക് ഞങ്ങൾ എത്തിയിരിക്കുകയാണ്. ഇപ്പൊ ഞങ്ങള് തിയേറ്റർ ഹോൾ സൊല്യൂഷൻ പ്രൊവൈഡർ എന്ന നിലയ്ക്ക് മോഡുലാർ തിയേറ്റർ, സർജിക്കൽ ടേബിൾ പല ലെവലിലൂടെ വന്നു. ഇന്ന് നമ്മൾ ഒരു ഇന്റർനാഷണൽ ബ്രാൻഡിന്റെ ഒപ്പോ അതിനപ്പുറവും നിൽക്കുന്ന ഫീച്ചേഴ്സ് ഉള്ള ടേബിൾസ് നമ്മൾ ഉണ്ടാക്കുന്നു. ഞങ്ങളുടെ സർജിക്കൽ ലൈറ്റ് വന്നു, സ്റ്റെറിലൈസർ, സോ എവറിത്തിങ് ഈസ് എ സൊല്യൂഷൻ പ്രൊവൈഡറാണ്. വലിയ സന്തോഷമുണ്ട് എനിക്ക്. ഇവിടെ ഡോക്ടർ സഹദുള്ളയുണ്ട്, ഡോക്ടർ അലക്സാണ്ടർ ഉണ്ട്. ഇവരൊക്കെ ഞങ്ങളെ എത്രയോ കാലമായിട്ട് സപ്പോർട്ട് ചെയ്തിരുന്ന ആൾക്കാരാണ്. ഇവരിലൂടെയാണ് ഞങ്ങൾ വളർന്നത്. അതിൽ വലിയ സന്തോഷമുണ്ട് പറയാനായിട്ട്. പിന്നെ എനിക്ക് വളരെ കുറച്ച് കാര്യങ്ങൾ മാത്രമേ പറയാനുള്ളൂ. നേരത്തെ എൻ്റെ ഒരു സുഹൃത്തോടെ പറയേണ്ട ഈ R&D എന്ന് പറയുന്ന ഒരു സാധനം, ഈ R&Dക്ക് വേണ്ടി നമ്മുടെമാരുള്ള ഒരു പ്രൈവറ്റ് സ്ഥാപനങ്ങളിലേക്ക് സമയവും പൈസയും ചെലവഴിക്കുന്നതിൽ ഒരു വലിയ പരിധിയുണ്ട്. അതിലപ്പുറം നമുക്ക് ചെയ്യാൻ പറ്റില്ല. അപ്പൊ ഇന്ന് ഡോക്ടർ സഹദുള്ളയ്ക്കോ ഡോക്ടർ അലക്സാണ്ടറിനോ ആവശ്യമുള്ള ഒരു സാധനം എന്താണെന്ന് കണ്ടെത്തുകയും അതിനുവേണ്ട R&D ചെയ്തുകൊണ്ട് ഞങ്ങളെ ആ സാധനം ഏൽപ്പിക്കുകയും ചെയ്താൽ ഞങ്ങൾ ആ സാധനം പ്രൊഡ്യൂസ് ചെയ്തിട്ട് തരും. ഞങ്ങൾ പല തരത്തിലുള്ള സാധനങ്ങൾ ഞങ്ങളതായിട്ട് ഡെവലപ്പ് ചെയ്ത് വന്നിട്ടുണ്ട്. അപ്പൊ ഇന്ന് നമ്മുടെ മെഡിക്കൽ ഡിവൈസ് ഇൻഡസ്ട്രിയിൽ ഏറ്റവും കൂടുതൽ ഒരു വലിയ എമൗണ്ട് ആണ് നമ്മൾ ഇമ്പോർട്ടിന് വേണ്ടി ചെലവഴിക്കുന്നത്. അതിന്റെ ആവശ്യമുണ്ട്. ഞങ്ങളൊക്കെ ഇവിടെയുള്ള ത്തോളം കാലം അതിന്റെ ആവശ്യമില്ലെന്ന് എനിക്ക് തോന്നുന്നു. ഇൻഡസ്ട്രിയും മെഡിക്കൽ ഫാറ്റേണിറ്റിയും ഇന്ന് ഈ വേദിയിൽ വരാനുള്ള ഏറ്റവും വലിയ സന്തോഷം എന്താ വെച്ചാല് ദിസ് ആൻ ഐഡിയൽ പ്ലാറ്റ്ഫോം. മെഡിക്കൽ ഫാറ്റേണിറ്റിയിൽ ലീഡിങ് ആയിട്ടുള്ള വളരെ പ്രസിദ്ധരായിട്ടുള്ള ഹോസ്പിറ്റലിന്റെ ഡയറക്ടേഴ്സും ഡോക്ടേഴ്സും ഇവിടെ ഉണ്ടാകുന്നു. മാനുഫാക്ചറിങ് ഈ ഹോസ്പിറ്റലിൽ പ്രൊവൈഡ് ചെയ്യുന്ന ഡിവൈസ് പ്രൊവൈഡർ ഞങ്ങൾ ഇതിന്റെ കൂടെ നിൽക്കുന്നു. ഈ ഒരു പ്ലാറ്റ്ഫോമാണ് എൻ്റെ മനസ്സിൽ ഒരു 45 വർഷം മുമ്പ് ഉണ്ടായിരുന്നു. നമ്മുടെ പ്രൊഫസർ NG മാണിയൊക്കെ ഉള്ള കാലത്ത് മനസ്സിലെടുത്ത് ഞാൻ പറയുമായിരുന്നു ഇതിനൊരു പോസിബിലിറ്റി ഉണ്ടാവുന്നു. ഇന്നിപ്പോ കുറച്ചു കാലമായിട്ട് ഫിക്കിയുടെ നേതൃത്വത്തിൽ അതിനുള്ള ഒരു അവസരവും വന്നിരിക്കുന്നു. അപ്പൊ ഇത് നമുക്ക് കൂടുതൽ ലെവലിലേക്ക് മുന്നോട്ട് കൊണ്ടുപോവുകയാണെങ്കിൽ നമുക്ക് ഇമ്പോർട്ട് സബ്സ്റ്റിറ്റ്യൂട്ട് നിലയ്ക്ക് ജോൺ ഒക്കെ സംസാരിച്ച രീതിയിൽ നമുക്ക് മുന്നോട്ട് കൊണ്ടുപോകാൻ കഴിയും.
Dr. Shaudula sir, the Honorable Minister has joined.
Yeah, Minister joined. Honorable Minister, we want to welcome you. And can we finish this session and come back to welcoming you? Okay, that will be there. We are just finishing this session. Okay, Ravindran, please go ahead.
Okay, welcome, Minister. Let me complete this. അപ്പൊ ഇത് ഇന്ന് നമ്മൾ കേരളത്തിലും ഇന്ത്യയിലുമായിട്ട് ഇമ്പോർട്ട് ചെയ്യുന്ന ഒരു മേജർ സെഗ്മെന്റ് ഓഫ് സാധനങ്ങൾ ചൈനയിൽ നിന്നുള്ള സാധനം. ഇന്ന് ഇന്റർനാഷണൽ ബ്രാൻഡിലുള്ള ഇന്റർനാഷണൽ കമ്പനീസ് പലതും ചൈനയിൽ ഒരു മാനുഫാക്ചറിങ് ഫെസിലിറ്റി തുടങ്ങുകയും അവിടെ നിന്ന് ഇന്ത്യയിലേക്കും ഒക്കെ എക്സ്പോർട്ട് ചെയ്യുന്നുണ്ട്. ഇതെല്ലാം ഇന്റർനാഷണൽ ബ്രാൻഡിന്റെ പേരിലാണ് ചെയ്യുന്നത്. പക്ഷേ ഇറ്റ്സ് മെയ്ഡ് ഇൻ ചൈന. അതിന്റെ ക്വാളിറ്റിയുടെ കാര്യങ്ങൾ ഞാനിപ്പോൾ പറയുന്നില്ല. ഡോക്ടർ സഹോദരൻ, ഡോക്ടർ അലക്സാണ്ടറിനും അറിയാവുന്നതാണ്. അപ്പൊ അത് ചെയ്യുന്നതിന് പകരം നമുക്ക് ഈ ഒരു മേജർ ഷെയർ നമുക്ക് ഇന്ത്യയിലുള്ള മാനുഫാക്ചറേഴ്സ് തന്നെ കിട്ടുന്ന രീതിയിലാവുമെങ്കിൽ അതൊരു വലിയ സക്സസ് ആവുമെന്ന് എനിക്ക് തോന്നുന്നു. ഇവിടെയുള്ള മാനുഫാക്ചറേഴ്സിന് ഗുണകരമാവും. ഇവിടെയുള്ള വർക്കേഴ്സിന് ജോലി സാധ്യത കൂടുതൽ പേർക്ക് ജോലി കൊടുക്കാൻ കഴിയും. അതാണ് ഒരു കാര്യം പറയുന്നത്. അത് മാത്രമല്ല, ഈ ചൈനീസ് എന്ന് പറയുന്ന സാധനം ഇന്റർനാഷണൽ ബ്രാൻഡിലുള്ളത് ചൈനയിൽ മാനുഫാക്ചർ ചെയ്യുമ്പോൾ അതിന്റെ ക്വാളിറ്റി എത്ര % കുറയുന്നതൊക്കെ നമ്മുടെ ഡോക്ടേഴ്സിനും അറിയാവുന്നതാണ്. വേറൊന്ന്, നേരത്തെ ഞാൻ പറഞ്ഞ മാതിരി ഈ R&Dയിലേക്ക് നമുക്ക് എങ്ങനെയാണ് ഒരു സെൻട്രൽ R&D സ്റ്റേഷൻ ഉണ്ടാക്കുകയാണെങ്കിൽ നമ്മൾ ആവശ്യമുള്ളവർക്കൊക്കെ അത് ഉപയോഗിക്കാൻ പറ്റുമോ? അതല്ലെങ്കിൽ തന്നെ നമ്മുടെ IIT-മായിട്ടുള്ള സ്ഥാപനങ്ങളുടെ കരിക്കുലത്തിൽ ഉൾപ്പെടുത്തിക്കൊണ്ട് നമുക്ക് കൂടുതൽ R&D ഡെവലപ്പ് ചെയ്യാൻ പറ്റുമോ എന്നുള്ള കാര്യം ആലോചിക്കുന്നത്. ഇത്രയും എനിക്ക് പറയാനുള്ളൂ. താങ്ക് യു വെരി മച്ച്, ഡോക്ടർ സഹോദരൻ.
Yeah, thank you very much, Ravindran. I think that was very helpful, very brevity, but beautiful points. You are a single operation theater total solution provider, and R&D is a very, very important factor. And if government can help in that matter, and we will elaborate to the Honorable Minister. So, Bibu, would you like to shortly, so that session can be finished before we go back to welcome our Honorable Minister? Bibu Punuran, he is a co-chair of the Healthcare Committee and also Director, Medivision Scan and Diagnostic Research. Over to you, Bibu. Thank you.
Good afternoon, everyone. I'm indeed very happy to be here this afternoon to speak to you. But I am not a manufacturer and I have been put into the Atmanirbhar space. So I thought I am actually a service provider. So after having 3 people who are manufacturers from the state of Kerala speak, I can stress on the point, especially since our minister is also listening. I will just stress on a few points like, for a fact that we know Kerala happens to be the most sought after health destination in our country in terms of quality healthcare. There's no doubt about that. And when it comes to Atmanirbhar in the diagnostic space, I can also proudly say that we are a chain of diagnostic centers based in Kerala, having expanded across Kerala. Now we are into Tamil Nadu. And in that sense, we are also very much part of the Atmanirbhar scheme, I could say. We've been in existence for the last 27 years, and it is the Kerala atmosphere that has also helped us grow into one of the largest chains. And we are probably the only diagnostic chain right now in Kerala having a Pakka Keralite ownership. That is also another reason to make myself proud. Now, coming to the fact of our industry, the hospital industry as well as the diagnostic industry, let me highlight the fact that we are also using many of the diagnostic equipments and the reagents based in Kerala. Thomas John will agree that at Medivision we always use or a large part of Agape equipments as well as the reagents. And then Honorable Ministers, Srimati Veena George, I would request you to kindly consider that while we give quality services, I'm not talking about my company, I'm talking about Kerala as a whole, we also expect reasonable returns on our investments. My humble request is that the government may also hear us out after considering our investments, costs of inputs on reagents, manpower, etc., before unilaterally asking us to reduce our pricing on services. There may be one-off cases where profiteering has been happening, but that's not the case of the majority. Please consider that always. Perhaps the community that has been most badly affected and has had to work tirelessly, risking their lives during the pandemic, has been the healthcare workers, as much in the private sector as in the public sector. But as you know, the private sector people have never had their own securities like the public sector. And yet, if they have to be given a decent remuneration, we have to meet our bank loan facilities, obligations, and also keeping up the standards of NABL, NABH, ISO, CAP, and other accreditations, as the case may be. We should also be able to meet all our ends meet with reasonable pricing. I would also request that when we are compared with the low prices in terms of lower rates in other states, we should also be compared with the high quality of services that we provide. Even for post-rehabilitation in Kerala, the private healthcare sector is playing a major role. I end up with a positive note to our health minister that we, the private sector, will offer all our support to our state, not only during these trying times, but also in future, in the times ahead. Thank you once and all.
Thank you, Bibu Puneran. Thank you very much for that brevity and small notes. And of course, every service suffers when there are no returns. And we all appeal to our honorable minister, to look into the matter. We will come back on it. And so over to you, Deepak, Mr. Deepak Ashwani, the co-chair of FICCI, to welcome our honorable minister. And then we can go forward.
A very pleasant good evening to all present today. It's a rare occasion that you have a welcome speech in the middle of a seminar, but it's still worth it since we've got an exclusive chief guest, that is the Honorable Minister for Health and Family Welfare, Women and Child Development, Government of Kerala, Srimati Veena George. And it is the first time that the Honorable Minister is actually addressing exclusively a FICCI event. We are grateful for your esteemed presence, ma'am. This virtual interactive meeting organized by FICCI assumes great significance in these times. Ever since the COVID pandemic struck the country, FICCI at the national level and state level has been collaborating with the central government and state government in its efforts to contain the pandemic. Massive vaccination drives have been undertaken at various parts of the country and the state by FICCI, in not only vaccinating FICCI members, their families, employees, and the local community of the respective organizations. Dr. Saadullah, in his opening note, will cover all details on FICCI and its initiatives in the health sector. This seminar will greatly benefit a variety of organizations and their members. The sessions that you missed out, ma'am, one is the sustainable strategies for hospitals in Kerala to tide over the pandemic, that is post the COVID pandemic. We also hope that an array of medical devices and equipment manufacturers and service providers can help the state and the country to build a strong health infrastructure for an Atmanirbhar Bharat, and we can truly see a strong Kerala post-COVID. FICCI has over the recent years organized a variety of programs focusing on health, be it virtual conferences to forecast and administer COVID vaccines, combating COVID in Kerala through hyper-automation, clinical testing and diagnostic services, managing the oxygen crisis, and bringing on board indigenous oxygen concentrator manufacturers, bridging the gaps between hospitals and patients. Retirement benefits, planning in the light of the pandemic, formulating strategies, and providing suggestions on the way forward to tackle the crisis, and doing an impact assessment on the business sector owing to COVID. Ladies and gentlemen, Srimati Veena George, Honorable Minister, needs no introduction as she is very familiar to the health sector, industry and trade at large, and to the august gathering of the galaxy of captains of health sector and hospital industry present here. I will now briefly introduce her. Srimati Veena George is an Indian politician and currently the Minister for Health and Family Welfare in the Government of Kerala. She is a two-time legislator who represents Aranmula constituency in the Kerala Assembly. With her induction in the Pinarayi Vijayan-led LDF coalition cabinet, Srimati Veena George earned a rare achievement of being the first woman journalist to reach the position in Kerala. Prior to joining politics, she has worked with major Malayalam news channels for over 16 years. She is also the first female executive editor among Malayalam news channel. Her TV news channel career extends from Kairali TV to Manorama News, then to India Vision, Reporter TV, and also New TV New. With immense happiness as the co-chair of FICCI Kerala State Council, I extend a very warm welcome to Srimati Veena George, our Health Minister.
Thank you.
As part of my duty, I welcome my colleague, co-chair of FICCI, Dr. M.I. Saadullah, who's in the forefront of all the health care and one of the primary players from Trivandrum. I'm delighted to extend warm welcome to all expert speakers for the sessions of the day. We had Dr. Harish Pillai, Chair, FICCI Medical Value Travel Committee, member FICCI Health Services Committee, and CEO, Aster India, Aster DM Healthcare Limited. Dr. Alexander KG, Chairman and Managing Director, Baby Memorial Hospital. Dr. Jayakrishnan AV, Consultant Neuro and Spine Surgeon, EMS Memorial Cooperative Hospital and Research Center. Sri Thomas John, Managing Director, Agape Diagnostics Limited. Sri John Kuriakos, Managing Director, Dentcare Dental Lab Private Limited, probably the world's second largest dentcare provider. Sri PM Ravindran, Managing Director, Palakkad Surgical Industries Private Limited. We just heard Sri Bibhu V. Punaran, Co-Chair, Healthcare Committee of FICCI Kerala State Council and Director of Medivision Scan and Diagnostic Research Center Private Limited. Dr. Joseph Benavin, General Secretary, Kerala Private Hospital Association. Dr. K.M. Nawaz, President, Kerala Private Medical College Management Association. And also we have a supporting partner for this event, that is Roche Diagnostics, and they are represented today by Sri Shishir Gupta in the absence of Mr. Narendra Bharde, Managing Director, India and neighboring markets. Finally, my warm welcome to all the senior officials of the health sector and all our esteemed invitees, members of FICCI and all participants. I hope this has been an interesting session so far, and I'm sure it's going to be even better and beneficial since we have the minister on board. Thank you so much.
Thank you. Xavier, can I go ahead and invite Shishir Gupta? Please.
Sir, I think Honorable Minister, just have a word with Honorable Minister at how much time Honorable Minister will be able to spare. I think then you can give the introductory remarks. Then get the Honorable Minister's suggestion. Then we can go with the.
Honorable Minister, what has happened is that in your absence, we had 2 sessions. We have done it, and there is one more session. And a brief note from me is waiting. And Shishir Gupta is the Roche director, who is here just to address, is from the diagnostic field. So we leave it to you. You want to say a few words and ask Shishir Gupta to speak, or whether he can speak, and whichever way the proceeding should go, because we have finished 2 sessions.
എല്ലാവർക്കും നമസ്കാരം. ആക്ച്വലി ഞാൻ 3 മണിക്ക് നേരത്തെ പറഞ്ഞ സമയത്ത് ജോയിൻ ചെയ്യണം എന്നൊക്കെ വിചാരിച്ചിരുന്നെങ്കിലും നമ്മുടെ സീക്കായുടെ ഒരു സാഹചര്യത്തിൽ cluster has formed inside the corporation, so I had a quick meeting with the DMO, district collector and all. So ഞാൻ അവിടെ ആയിരുന്നു. അതിനുശേഷം ഞാൻ വന്നേ ഉള്ളൂ. അത് എനിക്ക് 4:45 I got another meeting with my secretaries, so I'll be here for another 15-20 minutes. Sorry, ഇന്നത്തെ സാഹചര്യത്തിൽ അങ്ങനെ ആയതാണ്. ഓക്കെ, അത് കഴിഞ്ഞ് ഞാൻ അവസാനം ഞാൻ സംസാരിച്ചോളാം.
അങ്ങനെയാണെങ്കിൽ ഒരു കാര്യം ചെയ്യാം, ശിശു ഗുപ്ത വളരെ ഷോർട്ടായിട്ട് പറഞ്ഞിട്ട് then I can give a sum up, and then then മിനിസ്റ്റർക്ക് സംസാരിക്കാനായിട്ട് കുറച്ച് സമയം കിട്ടും. അല്ലെങ്കിൽ 20 minutes അല്ലേ ഉള്ളൂ. You have to go anyway. And so can we invite Shishir Gupta, Director Roche, to make it a brief and seat?
Absolutely. And thank you, Dr. Shardula. Honorable Madam, welcome. It's a privilege to be here speaking to you, and a warm welcome to all the FICCI co-members as well. I have a few slides. I'll keep it to less than, it'll be very few minutes. I understand the urgency. So I would like to take a minute to introduce about Roche. We are a healthcare organization, we are one of the leading organizations globally and also in India, because we focus across the entire healthcare continuum. We have a very big team on pharma. We have a very big operations in diagnostics. I am representing the in vitro diagnostic solution, where we have a number of solutions across blood banks, commercial laboratories, hospitals. What is not getting highlighted here, but in the next couple of slides, is we partner with governments. We are also very much present across the state of Kerala. We partner with governments across the country as well on a number of programs. Now, in terms of our portfolio from a diagnostic standpoint, we cover the entire breadth as an organization. What I would like to urge and request you and the co-members of FICCI that is this pandemic has seen a lot of changes in terms of focus on the healthcare industry. But what is true and what is prevalent is the incidence of non-COVID diseases continue to be there. While Roche and all the members who are here, Madam, you are also here, everybody has been focused on COVID for last more than a year now. In fact, Roche has also been leading this and partnering on COVID management, whether it's with PCR tests or tests for inflammatory markers or antibody tests or antigen tests. Our request is that while we keep the focus on COVID, but we also work together to strengthen the healthcare system. This was also the request from some of the previous speakers on the non-COVID side of disease and incidences, because those diseases still exist. And as Roche, we have partnered with various states on number of programs, whether it is related to enhancing the blood safety when we look at the blood donations which happen in India, or even in the state of Kerala. State of Kerala has one of the best healthcare infrastructures in terms of blood donation management. But in terms of screening the blood samples which are donated, there are newer technologies which have been adopted across the world, even in India, by various states, which uses NAT technology to make it even safer for the people who get those donated blood. So we would want, from our vision, Roche's vision is that we work together as Roche in a PPP model, create center of excellence in Kerala, which can focus on multiple areas. Our solutions, the great thing is it can cover the entire breadth, whether you talk about blood safety, whether we talk about cervical cancer screening. Oncology is another area where Kerala has been at the forefront of managing cancer. But if we talk about cervical cancer, the second most prevalent cancer, there are newer technologies. HPV DNA test is there, which we would request for you to consider and adopt across the state. Even WHO in its latest guidelines has recommended that the screening for cervical cancer should now be done through a HPV DNA test, because it is more accurate and able to simplify the entire algorithm. So that is one area. Hepatitis has been a focus for the state of Kerala. The incidence is huge across India, in southern states as well. It's very big. Roche again has been a partner with various states. We would urge that if there is an opportunity, we can partner with the state for hepatitis, even for TB, to bring in the efficiencies which centralized testing brings to the system. The programs can be implemented through Center of Excellences, and we would love to hear, Madam, your view on how we can partner or support the government in this endeavor to look at other disease areas beyond COVID as well, how to build the infrastructure, how to engage, and how to implement such programs as well. So I will keep it very, Thank you, Dr. Shah.
Thank you very much, Shashir. And Yeah, Preeti, can I have my slides, please? Savio. Yeah, just a couple of slides, madam. It is an honor to have you, and I don't want to exchange too many greetings because of lack of time, but I want to mention that I have watched you few times in NDTV, a few interviews, and certainly we are proud to say that you are very impressive, and for very pointed questions from NDTV people. You just want for the first time you are coming to FICCI, just want to introduce FICCI and couple of points, and that's all. And then you can have your speech. The FICCI is the voice of India's business and industry. And please go ahead, Preeti. And it has more than 70 verticals. And it is established in 1927. So it has gone through India's independence, and it has gone through the industrialization, and also now the emergence as a economic power in the world. So FICCI has a lot to play. It has 4 committees, and one of the mainly the medical devices, biotechnology, pharmaceutical, climate and climate research and development. It serves members of national companies, and it has got more than 2.5 lakh companies relationship and membership. So I think it is one of the biggest business organization in India, and everywhere. About 700 employees employed in many states by FICCI. And what the government of Kerala can benefit from FICCI, I know that you may know very well. I'm repeating that we are a source of information, we are a source of data, and you can reach out most of the business firms through FICCI. And then lastly, but not the least, the collaboration. We have done a vaccination campaign. We were an integral part of it. We have done a lot of oxygen, for private, public sector, not private sector, public sector. And so a lot of collaboration with the government has been done in this pandemic, and we will continue to do. And at any time, we are available for you a call away. So how we can work together from the FICCI point of view. Next slide, please, Preeti. Yeah, and FICCI has the healthcare aim, very, very focused, universal healthcare. That's all our concern over the nation, and address rural-urban divide. And that's on the problems we have, and that we have to handle. And that is the goals of healthcare aim, goals of FICCI. Go ahead, please. Yeah. There is one more slide. Go ahead. Yeah, I don't have to say that healthcare in India, Honorable Minister, the public sector investment in the healthcare India, even the state and the central government put together, it may only come to about 2 to 3% of the GDP. Sometimes they say it might make about 3.5%. When UK is spending more than 10%, United States is spending more than 14% of the GDP. So today, healthcare needs a lot more attention than what we give, and a lot more investment than give. And if it is done, definitely it will give back in much better terms. One more slide, I think. There's a last slide. Yeah, the common man, and how can Kerala common man is, getting care. Out of pocket, 62%. And the global average that people spend from their own pocket for healthcare, only 18%. The rest of that in Kerala or India, by public sector, insurance is very low. Actually, many people spoke before we came about the insurance penetration. And then corporation is not corporation, sorry. Corporates. Corporates are the ones which gives some of the rest of the care. So 60% is mind-boggling. Somebody is spending out of pocket. And public sector is the subsidized care, and as well as the government care the government is providing. And please go ahead with the yeah, we are asking, the Kerala is, all the ways it is in the front line. We are the first in the strategic development goals. We are the first. Education, we are the most educated. Healthcare, the best in India, as seen by WHO and Niti Aayog. And ease of doing business, we are 8th or 9th. And we have plans to improve there very much. And yeah, please go ahead. Yeah, we will ask this last one, I think. We are asking many things. People, actually elaborated here. Some of them were excellent, and but I have sum up 3 points only. That is the pandemic control. And the pandemic control, the other measures you know very well, and you have to put a lot of effort, and you are putting, the whole government is focused on that. But the one area where we have to rapidly catch up is vaccine. And whatever vaccine it is, we have to get vaccinated 80% of the population. And second, if there is no healthcare, there is no industry, there is no business, and there is no happiness. So healthcare is very important, and you should give take it as a priority sector. I think you are a journalist, you are well known now, and definitely making healthcare priority sector, like some of the states in India, will definitely give more productivity to the state, and it will be the highest second or third employment generator in the state as well as in the country. And everyone knows, actually, just now, many of the speakers were talking about the employment generation. And in fact, I would like to mention, especially John Kuriakos, who is a den care laboratory technician. He's started with the 6 people, madam, and now he has got 4,000 people. And he's the second in the world. He is rated second in the world with all certifications, including FDA. And he can employ to 10,000 people with some very minimal modification. There are many people to be quoted, but I am only quoting him because he was a true success story who really put it forward just now, 5 minutes ago. And the third point is that private sector, whatever said and done, we are giving 65% to 70% of the care. And I'm coming from private sector, and I am, the chairman of the KIMS Health Group. And so our plea to you as Honorable Minister is, please recognize the contributions of the private sector and respect it. And that is what we want. And then everything will fall in its place, and we can collaborate, and that public-private participation is collaboration. Today, everyone all over the world in this pandemic area, pandemic season says either collaborate or perish. So I think everyone should collaborate, and we, not only government and the private sector, and the private sector and the private sector themselves. And that's all. Please go ahead. Yeah, thank you. You can discontinue the slide, please. Yeah. Madam, many of the people, some of the speakers, a lot of points have been brought out, but probably we will, I know that you are in the middle of Zika virus and all, and KIMS Health is also, because we were, first diagnosing the cases here. So I think we will leave it to you to talk now, because you may have only 10 minutes or 15 minutes. So other points, perhaps we will sum it up and send it to you, and or if you provide us another occasion, because we thought that it was a great occasion to have you for FICCI, and we wanted to present many things as well as really give suggestions where healthcare can be a big force in Kerala. And it is already, and is the best in the country, but we are benchmarking with international healthcare. Thank you, madam. Over to you.
Thank you very much, Dr. Sahadullah. I would like to thank you for organizing this meeting and inviting me to this program, because this is the first time I'm meeting the members of FICCI. എനിക്ക് വാസ്തവത്തിൽ 3 മണിക്ക് തന്നെ ഇത് ജോയിൻ ചെയ്യണം എന്ന ആഗ്രഹമുണ്ടായിരുന്നു. പക്ഷേ ഞാൻ തുടക്കത്തിൽ പറഞ്ഞു, അടിയന്തരമായ എനിക്ക് മീറ്റിങ്ങുകൾ ഓർഗനൈസ് ചെയ്യേണ്ടി വന്നതുകൊണ്ട് അതിൽ പങ്കെടുക്കാൻ പോയതാണ്. ആദ്യമേ എനിക്ക് പറയുവാനുള്ളത്, കേരളത്തിലെ ആരോഗ്യ ഹെൽത്ത് കെയർ സിസ്റ്റം എന്ന് പറയുന്നത് it includes both the government and the private sector. സർക്കാർ മേഖലയും സ്വകാര്യ മേഖലയും ഒന്നിച്ചാണ് കേരളത്തിന്റെ ഹെൽത്ത് കെയർ സിസ്റ്റം എന്ന് പറയുന്നത്. ഈ ഒരു കാലഘട്ടത്തിൽ, പ്രത്യേകിച്ച് COVID-19 പാൻഡമിക്കിന്റെ സാഹചര്യത്തിൽ, കേരളത്തിന്റെ പ്രൈവറ്റ് മേഖല നൽകിയ സഹകരണത്തിന് ഞാൻ നന്ദി പറയുന്നു. അതില് അതോടൊപ്പം തന്നെ പ്രധാനപ്പെട്ട നമ്മുടെ വാക്സിനുമായി ബന്ധപ്പെട്ട് ഇപ്പൊ നമുക്കറിയാം, കേന്ദ്ര ഗവൺമെന്റിന്റെ നയം അനുസരിച്ച് ഇത്ര ശതമാനം സ്റ്റേറ്റ് ആൻഡ് ഇത്ര ശതമാനം പ്രൈവറ്റ് സെക്ടർ എന്നുള്ളതാണ്. ആ രീതിയിൽ സംസ്ഥാന സർക്കാർ പ്രൈവറ്റ് മേഖലയിലൂടെ വാക്സിനേഷൻ പ്രക്രിയ മുന്നോട്ട് പോകുന്നത്, അതിനെ ഞങ്ങൾ സ്വാഗതം ചെയ്യുകയാണ്. കാരണം സംസ്ഥാന സർക്കാർ എല്ലാവർക്കും വാക്സിൻ നൽകണമെന്നുള്ളതും ഫ്രീ ആയി വാക്സിൻ നൽകണമെന്നും ആദ്യമായി ഇന്ത്യയിൽ തന്നെ തീരുമാനിച്ച സ്റ്റേറ്റ് ആണ്. പക്ഷെ നമ്മളുടെ കേരളത്തെ സംബന്ധിച്ചിടത്തോളം സസെപ്റ്റിബിൾ ആയിട്ടുള്ള ആളുകളുടെ എണ്ണം വളരെ കൂടുതലാണ്. നമുക്ക് സീറോ പെർവലൻസ് സ്റ്റഡി നടത്തിയപ്പോൾ we found that only 11% of the total population of Kerala was infected in the first wave. ഈ പാൻഡമിക്കിന്റെ ആദ്യത്തെ വേവിൽ 11% മാത്രമാണ് ഇൻഫെക്റ്റഡ് ആയിരുന്നത്. സോ what was 89%, രണ്ടാമത്തെ തരംഗത്തിന് മുമ്പ് 89% ആളുകൾ ഇൻഫെക്റ്റഡ് അല്ലാതെ ഇരുന്നു. അപ്പോ ഇപ്പോഴും when we compare the total number of patients with the total number of patients in other parts of the country, we can see that കേരളത്തിലെ എണ്ണം കുറവാണ്. So means that there are more susceptible persons in the state. അതുകൊണ്ട് നമുക്ക് വാക്സിനേഷൻ മാത്രമാണ് നമ്മുടെ ഒരു മുന്നിലുള്ള മാർഗം. അത് മുന്നോട്ട് കൊണ്ടുപോകുന്നതിന് വേണ്ടിയിട്ടുള്ള എല്ലാവിധമായിട്ടുള്ള സഹകരണവും തുടർന്നും ഉണ്ടാകണമെന്ന് ഞാൻ അഭ്യർത്ഥിക്കുകയാണ്. കേരളത്തിന്റെ ഒരു കേരള മാതൃക, കേരള മോഡൽ ആഗോളതലത്തിൽ തന്നെ പ്രശംസിക്കപ്പെടുന്നതാണ്. നമുക്കറിയാം, ഇവിടെ സൂചിപ്പിച്ചതുപോലെ സസ്റ്റൈനബിൾ ഡെവലപ്മെന്റ് ഗോൾസ്, അതില് കേരളം 1ാം സ്ഥാനത്താണ്. അതുപോലെ കേരളത്തിന്റെ ഹെൽത്ത് സെക്ടർ, ഈ പാൻഡമിക്കിന്റെ സമയത്ത് നമുക്കറിയാം, ആരും നമുക്ക് ഓക്സിജൻ ഇല്ലാതെയോ അതുപോലെ തന്നെ ICU ഫെസിലിറ്റി കിട്ടാതെയോ കേരളത്തിൽ ആരും മരണപ്പെട്ടിട്ടില്ല. അതിനുള്ള സാഹചര്യം, നമ്മളുടെ ഒരു സിസ്റ്റം നമ്മൾ ഡെവലപ്പ് ചെയ്തത് ആ രീതിയിലാണ്. വി ഹാവ് ഓൾവേസ് ട്രൈഡ് ടു കീപ് ദ നമ്പർ ഓഫ് പേഷ്യൻസ് ബിലോ ദ ഹെൽത്ത് കെയർ കപ്പാസിറ്റി ത്രഷോൾഡ്. സോ our strategy was always to drag the wave and also to keep the peak below the medical capacity threshold. അപ്പൊ അങ്ങനെയാണ് നമ്മൾ മുന്നോട്ട് പോകുന്നത്. നമ്മൾ ഓർക്കുന്നുണ്ടാകും, ഫസ്റ്റ് വേവിന്റെ സമയത്ത് മറ്റ് സ്ഥലങ്ങളിൽ ഫസ്റ്റ് വേവ് കഴിഞ്ഞ് ഒരു സെപ്റ്റംബർ ഒക്ടോബർ മാസം കഴിഞ്ഞപ്പോഴും നമുക്ക് കേസസ് ഉണ്ടായിരുന്നു. In January 2021, we contributed to almost 41% of the total cases in our country. And also ഈ സമയത്ത് നമ്മൾ ആ ഒരു സിമിലർ ഇതിലൂടെയാണ് കടന്നു പോകുന്നത്. നമുക്ക് ഈ പാൻഡമിക്കിനെ കണ്ടെയ്ൻ ചെയ്യുന്നതിന് വേണ്ടിയിട്ടുള്ള എല്ലാ പരിശ്രമങ്ങളും നമ്മൾ നടത്തുകയാണ്. ഈ അവസരത്തിൽ എനിക്ക് പ്രത്യേകമായി പറയുവാനുള്ളത്, ഇവിടെ ധാരാളമായി ഞാൻ എല്ലാ സ്പീക്കേഴ്സിനെയും അതുപോലെ തന്നെ ഞാൻ സംസാരിക്കുന്ന വിഷയങ്ങളും ഞാൻ കണ്ടിരുന്നു. ഇതില് പല വിഷയങ്ങളും വളരെ എല്ലാ വിഷയങ്ങളും ഗൗരവമുള്ളതാണ്. അല്ല, ഞാൻ പറഞ്ഞു, പാൻഡമിക്കുമായി ബന്ധപ്പെട്ട് പ്രത്യേകിച്ച് പോസ്റ്റ് കോവിഡ് റീഹാബിലിറ്റേഷൻ ഇൻ കേരള വളരെയധികം പ്രാധാന്യമുള്ളൊരു കാര്യമാണ്. ഇപ്പോഴത്തെ ഒരു സാഹചര്യത്തിൽ സങ്കീർണമായിട്ടുള്ള ഒരുപാട് രോഗങ്ങൾ പോസ്റ്റ് കോവിഡ് ഡിസീസസ് ഉണ്ടാവുന്നുണ്ട്. അപ്പൊ ആ രീതിയിൽ നമുക്ക് വലിയ പ്രാധാന്യത്തോടെ അത് കാണേണ്ടതാണ്. റീഹാബിലിറ്റേഷൻ ഈസ് ഓൾസോ വെരി ഇമ്പോർട്ടൻറ്റ്. ഞാൻ ഒരു കാര്യം അഭ്യർത്ഥിക്കാനുള്ളത്, ഇവിടെയുള്ള നൽകാൻ വന്ന അല്ലെങ്കിൽ ഇവിടെ നൽകുന്ന പ്രസന്റേഷൻ, അതിന്റെ പോയിന്റ്സ് നിശ്ചയമായിട്ട് നൽകുകയാണെങ്കിൽ അത് ഗൗരവത്തോടെ തന്നെ അതില് ഇടപെടലുകളും ഉണ്ടാകും, അതിനെ നോക്കിക്കാണും എന്ന് ഞാൻ ഈ അവസരത്തിൽ പറയുകയാണ്. മുന്നോട്ടുള്ള നമുക്കറിയാം, കേരള ഒരു മാതൃക സൃഷ്ടിച്ചിട്ടുണ്ട്. കേരള ഹാസ് ക്രിയേറ്റഡ് എ മോഡൽ. സോ ഒരു ബ്രാൻഡ് ആയിട്ടുണ്ട് കേരളത്തിന്റെ ഹെൽത്ത് കെയർ സിസ്റ്റം. സോ ദ ഫ്യൂച്ചർ ഡെവലപ്മെന്റ് ഓഫ് കേരള ഈസ് ഓൾസോ, അത് ഡിപ്പെൻഡ് ചെയ്യുന്നത് നമ്മുടെ ഹെൽത്ത് കെയർ സിസ്റ്റത്തെ കൂടിയാണ്. വി ഹാവ് മെനി റിലേറ്റഡ് തിങ്സ്. ഈ ഹെൽത്ത് കെയറുമായി ബന്ധപ്പെട്ട് പല കാര്യങ്ങളും നമ്മുടെ ചെയ്യാൻ കഴിയും. അതില് ആയുർവേദയ്ക്കും പ്രത്യേക പ്രാധാന്യമുണ്ട്. നമ്മുടെ ആയുഷുമായി ബന്ധപ്പെട്ടിട്ടുള്ള 2 ഡിപ്പാർട്ട്മെന്റുകൾക്കും പ്രത്യേക പ്രാധാന്യമുണ്ട്. എല്ലാ നമ്മുടെ അലോപ്പതി പോലെ തന്നെ ഈ മുന്നോട്ടുള്ള പോക്കിന് എല്ലാവരുടെയും സഹകരണം ഉണ്ടാകണമെന്ന് മാത്രമാണ് എനിക്ക് അഭ്യർത്ഥിക്കാനുള്ളത്. ഇവിടെ പറഞ്ഞിട്ടുള്ള കാര്യങ്ങളൊക്കെ ഞാൻ വന്നതിന് ശേഷം പറഞ്ഞ കാര്യങ്ങൾ കേട്ടു. അതോടൊപ്പം തന്നെ മുന്നോട്ടുള്ള നമ്മുടെ പ്രയാണത്തിനും എല്ലാവരുടെയും നമുക്ക് ക്വാളിറ്റി ഹെൽത്ത് കെയർ എൻഷുർ ചെയ്യുക എന്നുള്ളതാണ് നമ്മുടെ ലക്ഷ്യം. ആർദ്രം പദ്ധതിയിലൂടെ ഇൻഫ്രാസ്ട്രക്ചർ ഡെവലപ്മെന്റ് ആണ് നമ്മൾ ശ്രമിച്ചിട്ടുള്ളത്. ഇപ്പോൾ ഏറ്റവും അധികം ഇൻവെസ്റ്റ്മെന്റ് കേരള സർക്കാർ ചെയ്യുന്നതും ഹെൽത്ത് കെയറിനാണ്. ആരോഗ്യ മേഖലയ്ക്കാണ് ഏറ്റവും അധികം പോസ്റ്റ് ക്രിയേഷൻസ് ഉണ്ടാകുന്നത്. ഏറ്റവും അധികം ഇൻവെസ്റ്റ്മെന്റ്സ് ഉണ്ടാകുന്നത് ഹെൽത്ത് കെയർ സിസ്റ്റത്തിനാണ്. ഇൻഫ്രാസ്ട്രക്ചർ ഡെവലപ്മെന്റ് കഴിഞ്ഞ 5 വർഷം ഏറ്റവും അധികം നടന്നത് ഹെൽത്ത് കെയർ ആരോഗ്യ മേഖലയിലാണ്. ഏറ്റവും കൂടുതൽ പോസ്റ്റ് ക്രിയേഷൻസ് നടന്നിട്ടുള്ളത് ആരോഗ്യ മേഖലയിലാണ്. സോ നമ്മളുടെ ഒരു പ്രയോറിറ്റി ആരോഗ്യ മേഖല അതിന്റെ മുൻഗണനയിലുണ്ട്, സർക്കാരിന്റെ മുൻഗണനയിൽ. ഇപ്പൊ ഈ വർഷത്തെ ബജറ്റിൽ തന്നെ നമ്മൾ നോക്കുമ്പോൾ കാണാം, ഏറ്റവും അധികം പണം അനുവദിച്ചിട്ടുള്ളതും ആരോഗ്യ മേഖലയ്ക്കാണ്. സോ അവർ എയിം ഈസ് ടു എൻഷുർ ക്വാളിറ്റി ട്രീറ്റ്മെന്റ്, ക്വാളിറ്റി ഹെൽത്ത് കെയർ ടു അവർ പീപ്പിൾ. അതില് ഗവൺമെന്റിനൊപ്പം പ്രൈവറ്റ് സെക്ടറിനും പ്രൈവറ്റ് മേഖലയ്ക്കും വലിയ പ്രാധാന്യമുണ്ട്. വലിയ മാറ്റങ്ങൾ മുന്നോട്ട് നമ്മളെ തേടിയിരിക്കുന്നു. അതില് ഇപ്പൊ കോവിഡിന്റെ കാര്യം തന്നെയാണെങ്കിൽ ട്രീറ്റ്മെന്റ് പ്രോട്ടോകോൾ ഈസ് ഇവൻ ചേഞ്ചിങ്. ഓരോ ദിവസവും ട്രീറ്റ്മെന്റ് പ്രോട്ടോകോളും ഒക്കെ ചേഞ്ച് ചെയ്തുകൊണ്ടിരിക്കുകയാണ്. അപ്പൊ മുന്നോട്ടുള്ള പ്രയാണത്തിൽ എല്ലാവരുടെയും സഹകരണം ഉണ്ടാകണമെന്ന് മാത്രം അഭ്യർത്ഥിച്ചുകൊണ്ട്, ഞാൻ കേട്ടില്ല എങ്കിൽ പോലും മൈ ഓഫീസ് ഈസ് അറ്റൻഡിങ് ദ പ്രോഗ്രാം. ഐ ആം ജോയിനിങ് അനദർ പ്രോഗ്രാം, ബട്ട് അനദർ മീറ്റിംഗ്, ബട്ട് മൈ ഓഫീസ് ഈസ് ഹിയർ. അത് കേട്ട് ബാക്കി നടപടികൾ ഒക്കെ സഹകരണവും ഉണ്ടാകുമെന്ന് മാത്രം പറഞ്ഞുകൊണ്ട് എന്റെ വാക്കുകൾ അവസാനിപ്പിക്കുന്നു. താങ്ക് യു വെരി മച്ച്.
മാഡം, 1 മിനിറ്റ് ഉണ്ടോ മാഡം? കഴിച്ചാല് ഒരു ചെറിയ ഒരു ഇത് ഫ്ലാഷ് ചെയ്യണമെന്ന് ഫിക്കിയുടെ പറഞ്ഞു. It won't take much time. You can have a minute or two. Yeah, Savio.
Just 1 minute, madam. This is a suggestion request from the Procter & Gamble, Nikhil Nair. They want to flag an issue regarding the essential and non-essential goods regarding the COVID pandemic. Nikhil, can you just come online? Yeah, Nikhil, 1 minute. Nikhil.
Hi, I can take over if Nikhil is not available. I'm Radhika Nair. I lead government relations and public policy for PNG. So, ma'am, we are extremely grateful to the Kerala government the way the pandemic situation has been managed across districts. So, in order to support the government, we have contributed an amount of rupees 50 lakhs towards the state's vaccination program, towards the Chief Minister Relief Fund. We have been constantly also contributing towards the women and child development programs, and we've been already contributing towards by giving sanitary pads and baby diapers. The main help that we need from you is to include these essential daily products like sand pads and diapers and detergents under essentials, as it is already a part of the MHA guideline. It has also been adopted under the essential category in several other states like Andhra Pradesh, Telangana and Karnataka. So a humble request would be to just include these daily essential products in the Kerala essential list also, because we face a lot of issues with delivery of these products to the local pharmacy and the grocery stores. And ma'am, you must be already aware that BBC had also run a media campaign, talking about how difficult it was for women to get access to these sanitary pads in the first lockdown. So that would just be a humble request, ma'am. And thank you for taking the time out to speak to us.
Thank you.
Thank
Thank
you.
you,
The
ma'am.
government will look into the matter. Definitely will look into the matter. Thank you.
Thank you, madam. We are continuing with another session, which is post-COVID rehabilitation. And so your office can listen to us. It will be great. And thank you very much. We have got a lot of thanks and all, but we just want to make informal.
You please continue with your programs.
Yeah. Okay. Thank you very much indeed. We appreciate your presence. Okay, thank you. Yeah, I think Deepak, we should continue with our third session, which is post-COVID rehabilitation in Kerala. And we have two honorable speakers, and both of them are very closely known to me. And Dr. Joseph Benavan is Executive Trustee of Lourdes College of Nursing, and division of Lourdes, that's a division of Lourdes Educational Academy, and is also the Managing Director of Canate Hospitals Private Limited, and is the General Secretary of Kerala Private Hospital Association, popularly known as KPHA. So I'm very happy to welcome you, Dr. Joseph Benavan, and to this session. And my another good friend, Dr. K.M. Nawaz, President, Kerala Private Medical College Management Association, and is a trustee of KMCT group of institutions. And certainly is very well known. His father was well known, Dr. Moidu, and he is the chairman, and he was personally known to me when I worked in Calicut. Dr. Nawaz took his up a challenge to make KMCT one of the best institutions in the self-financing sector, and certainly he has achieved that. And he is by himself as a radiologist in profession. So over to you, KM Nawaz, I'm very happy to invite you. And so we can start with Joseph Benavan. Dr. Joseph Benavan, can you go ahead, please?
Thank you, Dr. Saadullah, and all the other participants on this platform. It's actually been a long wait, but post-COVID is always wait. The healthcare sector, because I represent the Kerala Private Hospital Association, I think we will look at the healthcare delivery scenario in the post-COVID situation. During the COVID times, most of the private sector especially has gone through a lot of learning and unlearning process. The hospitals were exposed to their inadequacies. Because we had a lot of issues initially when COVID came up right on our face. Hospitals were not ready for it, but the resilience that hospitals have, we immediately got over the situation and we could bring things under control. But moving forward, this has to be a learning process. It's been a learning process, and we need to make necessary changes in the way we look at healthcare delivery from now on. So what I personally feel is the first aspect would be newer design concepts, the way we construct hospitals, because it's very important that hospitals have to be designed in future to maximize infection control systems. And we need to have flexible HVAC systems. And we also need to have very flexibility in the room allocation on the floors, wherein rooms can be converted to ICUs if there is a need. And moving forward, we know that dependence on hospitals is going to reduce over the years, and home-based care, as Dr. Harish Pillai had mentioned, that's going to take center stage in future. We may have virtual ICUs. These are the developments as far as the hospital setup is concerned. And I think hospitals, the healthcare sector needs to adapt itself to these imminent changes that's going to happen in the design concepts of hospitals. Then coming to Dr. Jayakrishnan had mentioned about the health insurance. We all know that health insurance penetration is very low across the country, less than 20%. But in Kerala, what we understand is, especially during our discussions with the government over the last 2-3 months with the COVID scenario, almost 40% of the health the families of the population in Kerala are covered under CASP. But unfortunately, CASP is ineffective, especially when the pandemic came in. We did a survey, and I think everybody was shocked to realize that only 20% of the private healthcare institutions in Kerala were empaneled under CASP. This actually is a matter of serious concern. We need to look into why. And the reasons are very obvious, as in the package rates are really unreasonable, and hospitals find itself in a very difficult situation to empanel in CASP because it becomes unviable to the hospitals. And also we have the issue of reimbursement, the reimbursement of package rates, wherein most hospitals go into liquidity crunch. Earlier, we had a major issue when Reliance was working on it, but now with the SHA, the State Health Agency, coming in, they are trying to be prompt, but still there are some lacunae which need to be looked into. So if CASP is streamlined, I'm sure a larger population will be able to overcome the out-of-pocket payments, and they could move into the insurance blanket. And the government is recently coming out. We've heard it in all the newspapers and news yesterday that with the Medicep insurance policy in association with a GIC company for government employees. But it will be worthwhile for the government to make it a foolproof system so that they don't repeat the same mistakes they made when CASP was affiliated to Reliance. So because especially when you have an insurance agency there, it is wrought with problems in the future. So another learning that we all, Dr. Saadullah has mentioned it in his presentation, is the collaborative effort of private hospitals. See, when the price capping was done, the government relied on the rates of the Kerala Medical Service Corporation as the yardstick on fixing the prices of N95 masks and PPE kits, wherein the quality was suspect. So the KPHA, the Kerala Private Hospital Association, with all its member institutions, is coming forward to form a common platform wherein we think we could negotiate directly with companies, and with large purchases, we should be able to bring down costs. Because one lesson that all hospitals, whether big or small, tertiary or quaternary, the lesson that everyone's learned during the COVID pandemic is that we need to contain costs, because we've been interacting with so many hospitals across various segments. And this is one lesson that we all need to learn and take forward in the days to come, that cost has to be contained. So how best can we contain costs is that we need to come together. Even with regard to the oxygen plant, the Kerala Private Hospital Association is putting in place plans to set up maybe a couple of common facilities to manufacture oxygen, so that we don't have this issue. And we also have the issue of price hike by oxygen companies, which was challenged and stayed by the Honorable High Court. So hospitals are always in the imminent danger of profiteering or price hikes by our vendors. So it's very important that like Dr. Saadullah said, collaborative effort between private hospitals is very important, and it's very essential as we move ahead with regard in the post-COVID scenario. See, all this was there, but it's just that we are learning things now because we've been faced with tough times. Otherwise, the journey was smooth. So when it's a rough shot, we go back and we try to reinvent the whole thing and re-engineer our systems and put it in place. Then one thing we need to do is what we're going to see in the future is digital health, because everything is going digitally. We already have telemedicine, teleconsultations and stuff going on. So what we would request is that the e-health program of the Ministry of Health and Family Welfare, see, this is at present, it's confined only to the government sector. So it's our request that the private sector also be included in the e-health program of the government, so that patient data moves across seamlessly between the private and the public sector, so that enabling better information exchange, better quality of care, better efficiency in the process, and healthcare services can be availed by patients across geographical boundaries, because everybody is there on the e-health platform. So this is one major aspect that the private hospitals need to push the government to include the private sector also in the e-health patient database system. Then, of course, the public-private partnership, which is most important. This was one major learning that we all had during the COVID times when the private hospitals were offering treatment to patients referred by the government sector. I think like it's the suggestion of the Kerala Private Hospital Association that the government hospitals should refer patients to the private hospitals, especially in rural areas where you don't have the facility. There is no point referring the patient to a distant government hospital for a particular care when that same care is available in a private hospital locally, and the payments can be made through payment vouchers of the government. Like there could be a contracted rate between the private sector and the government to provide care. See, COVID has been a great learning as far as public-private partnership is concerned, and it's our demand rather that the government takes forward this public-private partnership even beyond COVID, so that even non-COVID patient treatment can be given to patients who are in need, rather than shuttling patients from one place to the other, confining admissions and referrals only to the government sector. Then there is also a need to increase the number of public health lab infrastructure in the state. Dr. Harish Pillai had mentioned about gene sequencing. See, gene sequencing has to be done routinely, and it's our demand that private labs should be included in the gene sequencing. They should be granted permission to do gene sequencing. Because, see, even in COVID, this is another learning from COVID, when RT-PCRs initially everything about COVID was confined to the government sector, then the private sector, the private labs and the hospitals came forward in a big way to support the government to do RT-PCR. The same way that vaccination is being done. So we've got very good examples of public-private partnership, but what is important is the health minister, I'm happy to hear the health minister say that the private sector is a major player in the healthcare delivery system. But unfortunately, very often what happens is when the pandemic goes, when the crisis goes, the government tends to forget the private sector. But it's very important that we carry forward this torch of partnership between the private sector, because that's the only way we can go ahead. And that's what I would like to convey. Once again, I thank FICCI for this opportunity, and I hope FICCI and KPHA can work together for better healthcare in the state, for providing better healthcare in the state. Thank you so much.
Thank you, Dr. Benavan, because certainly I think FICCI is definitely working with all the private associations and players. It is very important, and your points of the collaboration, but the prices should be considered. Government e-health include the private sector, and even the labs and all, they should include the private labs. I think it's a very good points, and we will try to elaborate. And I think our minister's office is also recording it. Now it's my privilege to invite Dr. Nawaz. Nawaz, please take over. And what are your thoughts in this critical times?
First of all, I thank FICCI and Dr. Saudullah sir for inviting for this panel discussion on post-COVID rehabilitation. Even though I think the rehabilitation aspect is a medical aspect, I will restrict myself to my area, that is human resources in health. That is I represent medical colleges and teaching institutions, including dental and other colleges. So the concern is when we were at the peak of a first wave and second wave, the most important aspect what we faced was regarding the human resources in health. We had a reasonably good number of doctors, but when it came to nurses and paramedical staff, we were at a loss. And everybody knows that the most important resource the Kerala is having is the human resources in health. They were our ambassadors worldwide, and they had given the Kerala a lot of revenue also. But when the pandemic struck, we realized that that is not enough, and the human resources were moving from our state to the outside state, even to the other countries. There was advertisement by Agape that they are offering 12 lakh rupees for a senior consultant or a short stint in Kuwait without a tax. So that sort of things were happening. And so we have to have a real look at the the human resources, especially the nurses and paramedical staff. In fact, a recent Gazette order by Government of India says that any hospital which is having more than 300 beds can automatically admit 100 students per BSc nursing course. I'm sure that even Dr. Kim's or Baby Memorial Hospital may not be permitted by the local university or government to conduct 100 seats. And we have to realize that at least 4 or 5 times the number of people who are studying from Kerala are going to Karnataka and Tamil Nadu to acquire BSc nursing courses at institutions which are having dubious distinctions. Similar is the case of a paramedical. We don't have a respiratory therapist course, or we don't have an emergency technician course in our university. In a university approves only 6 or 7 graduation programs. And so the most of the people who want to study, they have to go either to deemed universities or neighboring states to do those courses. So my humble request to the Government of Kerala and university is we have to take a proactive steps to make sure that the Kerala needs this many courses in this many areas. And we have to make sure that with the available facilities, how can we ensure that that will happen? We should not be, the universities or government should not be a restrictive approach to this. We have to be facilitator rather than a policeman job they should not be doing. And another aspect is we need a lot of people like who are doing Master of Public Health. We have to study the health systems. So we need the people who does health systems studies, masters in health systems. Then we need a lot of health economists. So those are the areas where the medical education department should look into and be a facilitator in that field. I've been listening to the entrepreneurs in the medical devices department, devices, and I have already sent a message to Mr. Thomas John that we have a common meeting ground regarding the institute industry hospital interaction regarding the development of new diagnostics. In fact, I have visited Dendacare a long time back, and I was really impressed by the way the things are working there in a precision manner and how satisfied the employees were. And I think the Palakkad Surgicals have been associated from National Hospital itself, and now also KMCT is also associating. We can actually think of a private devices park rather than depending upon the government itself. If you have 20 acres of land, we can actually have a private industrial park without any government, and the KMCT is willing to be associated with that. So these are the few things I want to bring on board, and with these few words, I thank FICCI team for allowing me to speak here. Thank you very much.
Thank you, Dr. Nawaz. I think let me first say that when we said about post-COVID rehabilitation, it was not medical rehabilitation we meant. What exactly you said is what was the the requirement of the occasion. What Benavan said also is it's not rehabilitation we meant. What we wanted the whole thing, how we can settle down back to rehabilitation, not medical rehabilitation. So your points are well taken. I know that nurses seat to increase. You have to go to Kerala University, then you have to go to Kerala Nursing Council, and then you have to go to Indian Nursing Council. And so we are inviting, in fact, one of the forums, we are inviting these nursing councils to discuss with them. In fact, why are you objecting to it? And many other states are doing much easier. And that is, so the skilling point is very important. Respiratory technician. I have a course, nobody has recognized, but I am just doing it. And EMT, I have started just now. And so all these can be very well looked at the quality and approved by the KUHAS or any other agency. I quite agree with you. and then health economics and epidemiologists that need at the hour for public health. We very much appreciate your points, and we will see that somehow in some forums it reaches. I want to conclude with my apology that many of the things some of you mentioned have not been carried to but the Honorable Minister said that Mrs. Veena George said that her office is listening, and they will give a summary of the things, and I hope that will be useful. So I want to stop at this point, thanking each one of the speakers for giving valuable inputs in this a good session, which actually, personally speaking, I really enjoyed. But there's a lot of points which Minister could have answered or could have noticed. Because of our time constraints, we could not. Bibu, over to you just to conclude, and thank you.
Yeah, thank you. Once again, it is now time to end this beautiful meeting which we had, and a beautiful interactive section also. I thank all the speakers of the day. And first of all, let me thank co-chairs of FICCI, Dr. Saudullah and Mr. Deepak El Aswani, for taking the lead in organizing this program and taking this program forward. In fact, we had been waiting for a date for the minister, I think for the past 1 month or so after she has assumed charge. And we must congratulate FICCI office headed by Mr. Savio for having got her today on at least on an interactive session on Zoom. Let me thank Srimati Veena George, our health minister, first of all, for having offered all her support to the healthcare fraternity in Kerala. Of course, like Dr. Sadullah said, many of our points could not be heard by her in person, and we just hope that her office will carry this forward to her. And I'm sure that the FICCI office, we will definitely be forwarding all our points to her. In her absence, let me thank her once again for having addressed us today. And I would also like to thank Mr. Shishir from Roche, Shishir Gupta from Roche, for having spoken to us and also offering their support, the Roche support to the government of Kerala for the carrying forward the post-pandemic tests and containing many of the future pandemics in Kerala. Then, of course, as we all know, Dr. Harish Pillai is a voracious speaker, and he touched on all the aspects in a very eloquent manner. I do not know whether Dr. Harish Pillai is very much here right now, but whether he's here or not, Doctor, I don't see you on the screen. Thank you very much for having addressed the session today. And Dr. Alexander, once again, we thank you for having given us that short but point-based points to us. And Dr. Jayakrishnan, also, you have given us very valid points on the subject that was given to you about sustainable strategies for hospitals. And when it came to the manufacturer side, Mr. Thomas John, a good friend, and you spoke very well. And I think your point of R&D participation has to be well taken by the government, and and encouraging manufacturing facilities. Thank you very much, Thomas John. And Mr. John Kuriakos, you had no problems in mentioning your humble beginnings and to where you are. Actually, you make every Malayali proud. So we thank you not only for having addressed us, but also for making us proud that you are sitting in this state and employing about 4,000 people and taking Kerala to the rest of the world. And Mr. Ravindran, of course, with your Palakkad Surgicals, I understand that you're a second generation businessman who is a major supplier to most of the good hospitals in Kerala. Thank you very much for having addressed us. And Dr. Joseph Benavin, we thank you for that well thought out speech. After having heard all of the speakers, you have given your valid points. And Dr. K.M. Nawaz, also you have spoken based on what, on your subject knowledge and based on, the healthcare professionals, the need of the hour. You have spoken very well on that too. And definitely all of us would agree that, the sudden capping on pricing and all that is a major concern. And that is what the minister's office will have to take into consideration, because we all have our own infrastructural costs, our own our own manpower costs attached to it. Unlike the rest of India, we always provide quality services, and more or less we are all transparent in all our dealings. So the minister's office also, let us hope that since she is the new minister for health in our state, she will take things in the right manner and help us all out. And we should definitely have a public-private partnership in all areas in the healthcare sector. I would also like to thank all the participants of this program. I believe there are participants even on the YouTube link. So thank you all. Thank you all the hospital owners. Thank you all the manufacturing people and all the other healthcare workers who have joined us this evening and spent your valuable time with us. And last but not the least, I would also like to thank the entire FICCI office for having tirelessly worked towards this program, headed by Mr. Savio, Ms. Preeti, Mr. Ranjit, Ms. Serena, all of you. Once again, let us hope to have beautiful programs like this. And having heard Mr. John Kuriakos invite us to his facility, I think we should all take that as a cue. And Mr. John, I'm sure that the FICCI team will be visiting your Moatuvura dental facilities very soon. We will definitely be organizing that. Dr. Saudullah, I think we should take the lead for that, and we should do that, because even I have visited the Agape factory in Kadairipu. That is also a beautiful place. I think such kind of manufacturing facilities in Kerala, we should definitely encourage, and we should also.
Agape is due for a visit. No, actually, he came here in Trivandrum, and so we definitely need to go to his factory. And
yeah,
okay, please.
So thank you again. Thank you all for having joined us this evening. Once again, from all of us at FICCI, big thank you and good evening.
Thank you.
Yeah, Dr. Saudullah sir, just one word before concluding. Just add on to Dr. K.M. Nawaz, President Kerala Private Medical College Management Association, regarding the suggestion of the private devices park. In fact, FICCI is already in touch with the government. They have also approached the government. They have approached FICCI, or with our medical device and teams also for the life science park at Trivandrum. So we'll be soon convening a meeting with all the big players from the manufacturing medical device also. And definitely we can think upon this private medical park also in Kerala side with the leadership of the medical committee. Definitely we'll work on the same. And also, just one word of last thanks to all those participants who have joined for the FICCI bike platform also, and the link also for the YouTube link also joined. Large number of people have joined. Definitely we thank them for their participation. And definitely we will be submitting all the points, summarizing the points and submitting the minister, and also we'll be sharing the recording of the proceedings with the minister's office also. Definitely we will follow up the same also and ensure that some positive actions are taken from the government side also. Thank you, sir. Thank you, Dr. Saudullah sir, for wonderfully moderating the session, and Deep Kashmani sir and Bibu Punaran for coordinating the session. Thank you each one also. Thank you. Thank you.
All these parks come under KSIDC, I think.
Yeah, the parks comes under KSIDC.
Thank you. Thank you very much. Okay.
Thank you.
Thank you. Bye.